Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and county assemblies for the welfare of society and just government of the people, we beseech you to behold with your abundant favor as your servants, whom you have been pleased to call to the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county and of those whose interests you have committed to our church. Amen. Take your seats, honorable members. Next order.
Order number 1, administration of oath. Order number 2, communication from the chair.
Next order.
Order number 3, messages. Order number 4, petitions. Order number 5, papers.
Next order.
Order number 6, notices of motion. Order number 7, statements.
Next order.
Order number 8, question time.
Sergeant at Arms. Honorable members, you remember in December we did invite the CEC for Public Service Administration and Disaster Management to this chamber to shed light over a number of things. And in that discussion, there were issues that were not dealt with substantially. And today, as a follow-up of what we had requested, now this time, we also have those parties that we intended to have today with us. So Sergeant Atam, lead the CEC Finance, CEC Public Service, Transnet, and Jubilee invitees to the chamber so that we can be able to prosecute the business of today. Honorable members, as we wait for them to come, let's remind ourselves on the issues that we had placed on them, on the four parties. The County Executive Committee member for Public Service Administration and Disaster Management, Finance and Planning, Jubilee, Transnet, insurance companies, representatives to provide response to follow-up questions on discriminative and restrictive provisions of medical services to staff of the county executive arm of the county government. The CCM for Public Service Administration and Disaster Management was to provide, one, the status of engagement between the county government, the insurance provider, and the insurance broker. Two, the policy framework guiding medical benefits, capping for county government staff, and three, measures being undertaken to address disparities and ensure equitable access to medical services. Then for Jubilee Insurance, they are to provide information on the following: the basis of capping of medical benefits and the apparent differences in medical service provision among county government staff. Then Transnet Insurance brokers, they are required to clarify, one, the structure and administration of the medical insurance scheme. Two, the role of the broker in advising on benefits, limits, and capping. And three, factors contributing to variations in medical service provision to the county staff. I would like to take this opportunity, honorable members. The order of business is deliberated to consider matters arising from a question raised by Honorable Michael Emase, MCA Lapur Ward, concerning the alleged discriminatory and restrictive provision of medical services to staff of the county executive arm of government. Honorable members will recall this matter was responded to during a plenary sitting of the Assembly held on 10th December 2025, during which the County Executive Committee member for Public Service Administration and Disaster Management informed the House that engagements were ongoing between the county government, the insurance provider, and the insurance broker regarding issues of medical benefits, capping, and discrepancies in service provision to the county government staff. In keeping with the constitutional and statutory oversight mandate of this assembly, the House invited the concerned parties to appear before it in order to provide further clarification and information on issues raised. The appearance of the invited persons today is therefore intended to assist the House to better understand, one, the status of engagement between the county government, the insurance provider, and the insurance broker. Two, the policy and contractual framework guiding the capping of medical benefits for county government staff. Three, the structure and administration of the current medical insurance scheme, and four, the measures being undertaken to address any discrepancies and ensure equitable access to medical services for all staff. The House therefore welcomes the presence of the County Executive Committee member for Public Service, Administration and Disaster Management, the County Executive Committee member for Finance, the Jubilee Insurance Company Limited representative, and the Transnep Insurance Broker Limited representative who have been to assist the Assembly in its deliberation on this matter. Honorable members, this engagement is not adversarial in nature. Rather, it is part of the Assembly's responsibility to ensure accountability, transparency, and fairness in the management of public affairs, particularly where the welfare of county government staff is concerned. I therefore urge the invited persons to respond to the issues raised candidly and comprehensively, and I encourage honorable members to conduct the proceedings with the decorum and objectivity befitting this House. I now invite, having said that, and because I have gone through the issues which each party was supposed to respond, I now invite the first respondent to make their presentation to the House. I thank you. So, CC Public Service.
Thank you, Mr. Speaker. Mr. Speaker, I'm Patrick 𝐂𝐒𝐒𝐑𝐂, the County Executive Committee member in charge of Public Service, Administration, and Disaster Management. Mr. Speaker, I have come with my team. That is, I have come with my chief officer and the director in charge of human resource in that department. Mr. Speaker, this being the third invite to appear before this House and to respond on issues that pertains the rights of each and every staff of the county government in this county, Mr. Speaker. Mr. Speaker, I received the letter and on behalf of the ministry was asked to respond to 3 questions, Mr. Speaker. The first question is on the status of engagement between the county government of Turkana, the insurance provider, and the insurance broker. Mr. Speaker, the county government of Turkana entered into a formal contractual arrangement for the provision of comprehensive medical insurance cover for its employees county government on remuneration and benefits of public officers, including county government staffs. Thank you. Accordingly, the medical insurance package adopted by the county government is structured in strict adherence to SRC circulars on medical insurance benefits, including prescribed ceilings or capping by job groups. The scope of medical cover. The comprehensive medical cover provided by Jubilee Insurance Limited includes the inpatient, outpatient, maternity, dental, and optical services. Additionally, the scheme provides a last expense cover of 100,000 per employee across the job groups. The structure, Mr. Speaker, is there. Then B, tender document specification. The tender document specification comprehensively outlines the framework and operational structure of medical insurance cover for county staffs. And the specification is clearly defined. One, the scope of the medical cover, benefit limits and entitlements, eligibility criteria for staff and their dependents. Then claims management procedures and service delivery standards. All provisions within the tender documents are aligned with the applicable guidelines issued by SRC. This ensures that the medical scheme remains compliant with the national policy, promotes equity among the beneficiaries, and safeguards prudent utilization of public resources. Mr. Speaker, under that, Section C, the tripartite contract signed between the county government of Turkana, the Transneb Insurance, and the Jubilee Health Insurance. Mr. Speaker, a tripartite contract was duly executed between the Turkana County Government, Transneb, and Jubilee. This agreement is a legally binding instrument that clearly defines the roles, obligations, and responsibilities of each party. It provides a structured governance framework for the administration of the medical cover, including policy implementation, premium management, advisory oversight, and claims settlement. The third question, Mr. Speaker. Measures being taken to address disparities and ensure equitable access to medical services. Mr. Speaker, in response to this emerging concerns regarding staff access to medical services under the current medical insurance arrangement, the county executive has taken proactive steps to safeguard equity, fairness, and continuity of health care benefits to all employees. A consultative meeting was convened, bringing together key stakeholders to deliberate on the challenges experienced. The forum provided an open and structured platform for staff representatives and concerned parties to articulate the issues affecting the service access, benefit utilization, and provider responsiveness. Following the deliberations, the county executive, through the relevant department, formally engaged the insurance provider to seek comprehensive clarification on the concerns raised, address disparities in service access across facilities and regions, improve responsiveness and communication channels for beneficiaries, ensure consistent application of policy provision in line with contractual obligations, to develop practical, sustainable solutions to enhance service delivery. Mr. Speaker, in line with that, Mr. Speaker, there was a letter that was written to both Jubilee Insurance Limited, and I have the letter here, inviting them for a meeting on deliberation on the medical insurance disparities on offered services. Mr. Speaker, in the letter, the Jubilee Health Insurance, through a representative, Mr. Lawrence, committed to reviewing the contract and issuing a detailed response within the stipulated period, assuring members that practical solutions were being developed. Mr. Speaker, no formal response was, or remedial action was taken by the Jubilee Insurance as per the issues raised or experienced. The county executive in charge, through the office of the county secretary, the head of public service, he had a meeting to deliberate on the same issue. We wrote a letter to them, but to date, no response at all. Same to the Transnet Insurance company. The following matters, therefore, remain unaddressed in our letter. The specific concern raised by the county staff regarding service delivery remain unaddressed. The implementation of awareness and member education programs on Jubilee systems across all sub-counties to enhance understanding and accessibility of the medical scheme. It must be emphasized that the introduction of the management of LCT, was not part of the contractual agreement between the county government of Turkana, the Jubilee Insurance, and the Transnet as the broker. There was no any contractual agreement about or engagement between the government and LCT. As such, Jubilee is required to strictly adhere to the original terms of the comprehensive medical cover contract without diversion. Strictly. This continued lack of response and inaction on these matters is unacceptable and contrary to the spirit of partnership and accountability expected under the contract. The county government, therefore, demands an immediate written response, that's by then, outlining the corrective measures and timelines for full compliance with the agreed terms of partnership. Lastly, Mr. Speaker,
Point of order, Mr. Speaker.
What's it, Honorable Mike?
Thank you, Mr. Speaker. My point of order is in regard to the latest information the CC is taking us through. Mr. Speaker, we've looked at our iPads and that information is nowhere. So can we have copies of the same? Because that looks interesting, Mr. Speaker. Thank you, Mr. Speaker.
CC, I am also on the information you submitted to this House, and each one of us has that information. So could you submit the information you are reading, because it is not here. Submit the letter you wrote to Jubilee, then the response. I think what we require here is the response. You know, it is updating us on where we are as we speak. You know, these other things are things you did during that time, because it is explained. Those other of Transnet, they will explain themselves. But your position on the issues that were raised, that you were supposed to clarify, you know, what you are saying is not here. That's why you are saying we require that information. If it is there, give it to us. CC?
thank you, Mr. Speaker. Mr. Speaker, I have it here. And it is true that I did not attach with the report I forwarded to the House, Mr. Speaker. But if there is need for this one to be photocopied and supplied, then it's allowed.
Lay that information so that we can photocopy, so that we can follow. Otherwise, as it is, you are only talking to yourself.
Information, Honorable Speaker.
What is it on the same, Abdul Fattah?
Honorable Speaker, it's almost on the same note, but we also need the CEC to provide us the new information we are getting concerning this new entity called the LCT, which we do not have even the officers representing that agency here. We do not know where we can, we do not have enough information about this LCT. Maybe you can also give us that information. Thank you.
Yes, CC, there is an introduction of LCT, which even according to your information, came without your knowledge. It's not part of the contractual agreement. So would you please also, as you rise, shed light on what is LCT? Maybe if you say in full, if the party is here, then that will be in order.
Honorable Chair, information.
Information, Honorable Alain.
If you look at our iPads, the information which the CEC has just read is part of the response given by Transnet. If you look at the response given by the insurance broker, all what he has read, the LCT, all those things are there.
Order members, order CC, give us your bit. Other parties, let them answer because they are here. So I think don't speak for them. Just say what we require from you and stop there. If there is anything that you need to be clarified by your party, yes. But for other parties, they will clarify themselves.
Honorable Speaker, sir.
More that will be last on information.
Honorable Speaker, sir, it's not the information, but Mr. Speaker, sir, we're having a very honest CC today in this House. And how I wish that through your chair, you allow the CC to continue shedding more light to this honorable house. Mr. Speaker, sir, the details that have been given to us are not sufficient. But the answers that now the CC is giving, that is the total outcry that the members of the public are discussing about. Mr. Speaker, I will request through your chair, because this is now, it's your chair to determine, that today we've had a very, very honest CC in this county, who has said that he did a letter, and to date, they did not receive the response, Mr. Speaker. So what other response are we expecting? Let's allow the CC to shed more light on this matter. Whether there was breach on the terms of the contract, whether each party did not fulfill the terms of the contract. So, Mr. Speaker, through your chair, please just allow him to continue. Then they can submit to us the documents through your chair, Honorable Speaker.
Honorable Omodo, you are out of order, because the questions we gave to each party are supposed to be answered by the parties. Otherwise, another party cannot purport to answer on behalf of another party who is present. So,
thank you, Mr. Speaker. Mr. Speaker, on issue to do with the LCT, I will not be in a position to answer, because in the House here, I am confident enough that there is a responsible party that will answer that. It is an advantage to the House for me to introduce that term. So, Mr. Speaker, as I conclude, Mr. Speaker, because I am done with the questions that I was asked to answer. As I conclude, the county executive remains committed to protecting staff's welfare and upholding the principles of fairness, transparency, accountability in the administration of employee benefits, Mr. Speaker. So, Mr. Speaker, I wish to say I am happy with the invite. I have answered the questions that was asked. Thank you, Mr. Speaker.
thank you, CC, for public service. Now, Jubilee Insurance.
Thank you, Mr. Speaker. I'm Dr. Musa Misiani. I'm the Chief Operating Officer at Jubilee Health Insurance Limited. And I'm happy to present our response to the questions asked to us. We received a letter dated on the 10th of February inviting us to appear before the County Assembly to clarify to members relating to the medical insurance scheme for Turkana County government staff. We appreciate and respect the oversight role that the County Assembly is playing in safeguarding the interests and welfare of the county government employees and ensuring accountability in the administration of public programs. In this regard, we hereby submit our formal written response regarding the matters raised. Item number 1, the basis of capping of medical benefits. Mr. Speaker, the structure of medical benefits under the county government staff medical scheme is guided by the remuneration and benefits framework approved for county governments, and in particular, the benefit limits and applicable capping structures as determined in line with the guidance issued in 2014 by the Salaries and Remuneration Commission. Benefit limits and subsequent cappings of those limits are applied as per the approved structure, and they strictly adhere to 1, the tender document requirements issued by the Turkana County Government, SRC guidelines relating to medical benefits for county government staff, the terms and conditions contained in the signed contract between the Turkana government and Jubilee Health Insurance Limited governing the administration of the scheme. Jubilee Health Insurance Limited has no discretion to alter medical benefits outside the approved framework, and this ensures fairness, transparency, and compliance with national policy. Item number 2, on the apparent differences in medical service provision among county government staff. We acknowledge the concerns raised regarding the perceived differences in medical service provision among the county government staff, but we wish to clarify that medical services are administered in accordance with established healthcare protocols, which include primary care, referral to secondary, and subsequent tertiary care when required. And access to services at each level is guided by medical necessity, clinical justification, and the specific benefits outlined within the approved cover in line with the SRC framework I had mentioned earlier, Mr. Speaker. As such, any variations in service provisions may arise from differences in medical needs, referral pathways, or the scope of benefits under the respective cover rather than preferential treatment. To further strengthen transparency and accountability and effective scheme management, Jubilee Health Insurance Limited utilizes accredited benefit management technology platforms. And this include LCT Africa Limited, SLED 360, and Smart Access as our technology partners, Mr. Speaker. So these platforms support real-time eligibility verification through biometric verification, authorization of services, reporting, and fraud management. These integrated systems help to ensure that services are provided within the approved scope of cover and that public funds are safeguarded, and all staff members receive equitable access to medical services in line with the established guidelines. We have strictly adhered to contractual obligations, SRC guidelines, and constitutional requirements in administering the Turkana County Government Medical Insurance Scheme, and we remain committed to transparency, accountability, and prudent management of public resources. I'll submit that as my written submission, Mr. Speaker, and will be available to respond to any queries from honorable members. Thank you.
Thank you, Jubilee. Now we go to Transnep.
Thank you, Mr. Speaker. We are glad to report today further to the invite and the letter that was sent to us inviting Transnep Insurance Brokers to appear before this House. My name is Rosemary Wangare. I'm the General Manager at Transnep Insurance Brokers. I'm in charge of client service and retention. So we appreciate the oversight role that the County Assembly and hereby submit our formal written response. So on the first question, we were supposed to explain the structure and administration of the medical insurance scheme. So the medical insurance cover for Turkana County Government is structured as a tripartite arrangement, and with the three parties, that is the county government, the Turkana County Government as the policy holder. We have Transnep Insurance Brokers as the broker and Jubilee Health Insurance as the underwriter, in this case, the risk carrier. So under this arrangement, Jubilee Health Insurance assumes the insurance risk. That means they underwrite the policy and they settle all the claims. At Transnep Insurance Brokers, we provide advisory, we do monitoring, we do the advocacy for members and the oversight. And in this case, Turkana County Government remains the contracting policy holder representing its staff. So on the second question of what is the role of the broker in advising on the benefit limits and the capping. So Transnet Insurance Brokers is regulated by IRA, and we play a couple of roles. But to mention the ones that are relevant to this matter, Mr. Speaker, sir, is just advising the policy holder, in this case the county government of Turkana. We support benefit administration and interpretation. We represent the policy holder while engaging with the underwriter. We monitor the service delivery standards. We escalate complex medical cases for review. We facilitate communication between employer, insurer, and the providers. And we provide continuous member support and grievance handling. The broker, Transnet Insurance Brokers, does not alter the SRC approved benefit structure outside the contractual framework and remains facilitative, advisory, and supervisory. So, Mr. Speaker, sir, Transnet plays an active role in benefit administration, but the benefits remain as structured during the tendering process. So we continue to give 24-hour support, and we do direct coordination with Jubilee authorization team. We also provide liaison, when there are when we are called that members need any support at the hospital level, any billing discrepancies, and any delay that may occur therein during the process. And we also do escalation and advocacy. We are the go-between between the client, in this case the county government staff, and the underwriter. So on the third query, we were asked to respond to factors contributing to variation in medical service provision to the county government staff. Mr. Speaker, sir, we wish to clarify that as per the earlier mention that we do not alter the benefits, and we work hand in hand with the underwriter, in this case, Jubilee Health Insurance, who are our preferred medical insurance for this particular scheme. And we note that the number covered, the lives that were covered to date, they go beyond the original population, Mr. Speaker, sir. And so in that regard, the variation speaks to a number that has grown more than even what we started with. But therein, Jubilee Health Insurance continues to give services even without additional of extra premium because of the agreement we have and the partnership we have with the policy holder, the county government of Turkana. So despite this increase, the benefit structure remains aligned to the original contracted terms NSRC framework. So in terms of management, Jubilee Health Insurance utilizes the multiple administration platforms, like has been mentioned, Mr. Speaker, sir, and we shall be available to expound our choice of the platform, in this case, the LCT that has been mentioned in this house. Mr. Speaker, sir, the SRC benefit structure compliance, the benefit structure strictly adheres to the tender specifications, the guidelines, and the signed contract. The accessibility of services, Mr. Speaker, sir, remains our key guideline in how we administer, and that does not form in any way cause a variation. What we do, Mr. Speaker, sir, we follow the medical protocols. There is a primary health care, and there is a referral pathway, and therein there is a secondary and the tertiary. So approvals are based on medical necessity, clinical justification, and policy limits. In addition, Mr. Speaker, Transnet Insurance Brokers facilitates and ensures that the Quality Assurance Committee meets. With the last meeting on 8th of October 2025, a meeting that was held here at the county government of Turkana, and the matters that were reviewed include utilization trends, service delivery, performance, and emerging issues. Further, Transnep also facilitates ex gratia interventions. These are cases, Mr. Speaker, sir, that sometimes fall out of the policy, out of what is even contractual. But we have a moral obligation to support our clients on some very needy and cases that requires going out of the contract. So this is a responsibility of Transnep to ensure that even though some are not stipulated on the contract, that we go over and above to ensure that our partner, Jubilee Health, takes care of those cases that are outside. In conclusion, Mr. Speaker, sir, Transnep also supports during the suspension period, and that's my point number 10, where during the temporary suspension period, which will be discussed in this House, arising from the obligation between the county government of Turkana meeting the obligation of paying the premiums, we facilitate and we ensure that members still continued to get services even though there was that suspension period. And further, we are still facilitating reimbursement. The reimbursement is for members who had paid cash during that period. We have further shared the requirements that are needed so that the payment can be refunded to the members. So finally, Mr. Speaker, sir, Transnep Insurance Brokers remains committed to ensure that the scheme is administered with transparency. We continue with member support. We adhere to SRC and tender provisions. We stick to the structured governance and proactive escalation and humanitarian advocacy. We remain available to answer any queries that may arise. Thank you, Mr. Speaker.
Thank you, Transnep. CC Finance.
Thank you, Honorable Speaker. I'm here to respond to the question on alleged discriminatory provision of medical services to staff and members of the county executive. And we acknowledge the letter written to us on 12 March 2026, requesting for response to the question on the above mentioned subject on the medical insurance benefit structure for staff of the county government of Turkana as guided by the policy framework. 1, the SRC guidelines pursuant to Article 234 of the Constitution of Kenya, the Salaries and Remuneration Commission is constitutionally mandated to set and regularly review the remuneration and benefits of state officers and to advise both the national and the county government on remuneration and benefits of public officers, including the county government staff. Accordingly, the medical insurance package adopted by the county government of Turkana is structured in strict adherence to the SRC circulars on medical insurance benefits, including prescribed ceilings, stroke capping by job groups. The scope of the medical cover. The comprehensive medical cover provided by Jubilee Health Insurance Limited includes the following benefits components: inpatient services, outpatient services, maternity services, dental services, and optical services. Additionally, the scheme provides a last expense cover of 100,000 shillings per employee across all job groups to offer financial relief to families in the unfortunate event of a member's demise. In terms of the benefit structures by job group as given by the SRC, that table is there. I believe the honorable members have, because we have job groups from R&T having inpatient of 2 million, outpatient of 250,000, maternity at 150, dental 35,000, optical at 35. Staff at job group K to Q have inpatient cover of 1.5 million, 200,000 for outpatient, 100,000 for maternity, 30,000 dental, and optical 25. Staff at job group G to J, they have inpatient limit of 1 million, outpatient at 150, maternity at 75, dental at 30, and optical at 15. And the staff at job group A to F, they have inpatient at 750,000, outpatient at 100, maternity at 25, dental at 30,000, and optical at 15,000. Or the tender document specification, the tender document specification comprehensively outlined the framework and operational structure of the medical insurance cover for the county staff. This specification clearly defined the scope of the medical cover, the benefit limits and entitlements, eligibility criteria for staff and their dependents, claims management procedures, and service delivery standards. All provisions within the tender documents are aligned with the applicable guidelines issued by the Salaries and Remuneration Commission, SRC. This ensures that the medical scheme remains compliant with the national policy, promotes equity among beneficiaries, and safeguards prudent utilization of the public resources. The tripartite contract signed between the Turkana County Government, Transnet Insurance Broker, and Jubilee Health Insurance Limited. The contract was duly executed between the Turkana County Government, Transnet Insurance Brokers, and Jubilee Health Insurance Limited. This agreement is a legally binding instrument that clearly defines the roles, obligations, and responsibilities of each party. It provides a structured governance framework for administration of the medical cover, including policy implementation, premium management, advisory oversight, and claims settlement. The contract ensures accountability, transparency, and effective service delivery in the management of the county staff medical scheme, while protecting the interests of both the county government and its employees. The county government of Turkana entered into a contractual agreement for a comprehensive medical insurance cover, designed to cater for all the county employees across the various job groups. The agreement provides for a full range of medical services, including inpatient, outpatient, dental, optical, and maternity care. As stipulated in the contract, there are no benefits capping based on job groups. However, during the meeting held on 8 October 2025 at Atecare Hotel, it was noted that Jubilee Health Insurance had introduced certain limitations at health facilities without the consent or approval of the county government. This arrangement has raised concerns, particularly because it appears to deviate from the initial contractual understanding of a single comprehensive cover for all the employees. Clarification was sought from Jubilee Health Insurance on the rationale behind this dual management approach and its implication on service delivery and equity among staff. Jubilee Insurance clarified that this was an administrative issue involving their network hospitals and assured that the matter is being addressed to ensure employees continue to access services as per the terms of the contract. I do hereby submit. Thank you.
Thank you, CC Finance. Now, Honorable members, we have had responses from each party, and now I go back to the move of the motion. Honorable Mike, you've heard the responses. You can give your reply.
Thank you, Mr. Speaker. Mr. Speaker, I want to sincerely take this opportunity to thank and appreciate the two County Executive Committee members. That is the County Executive Committee member in charge of finance, finance and economic planning, and the County Executive Committee member for Public Service Administration and Disaster Management. I want also to thank and appreciate the representatives of the Jubilee and Transnep for their oral and written submissions in regard to these questions. Mr. Speaker, I have a number of concerns in regard to the responses earlier on provided. My first concern is in regard to the tripartite agreement. Mr. Speaker, this is not the first time the Jubilee Insurance is offering a medical cover to the members of staff of the county executive. Mr. Speaker, I want to hear from those who signed the tripartite agreement. Was the tripartite agreement signed in the best interest of the county workforce or the broker? Mr. Speaker, we would want to hear that. As I had said before, Jubilee Insurance has been there for some time. And even this county assembly has engaged with Jubilee Insurance on matters medical cover, Mr. Speaker. Mr. Speaker, we would want to hear from the executive why they decided to have a tripartite agreement with Jubilee Insurance and Transnep. The Jubilee Insurance failed in its roles and obligations now that we had an engagement with them earlier on in the previous years. So, Mr. Speaker, that is very important, and we would require a substantive response in that regard. Mr. Speaker, this matter is a very serious matter. Mr. Speaker, the county executive employees, they have suffered for the last 6 or 7 months when the issue of the medical cover was suspended, Mr. Speaker. Mr. Speaker, we've lost a number of county executive employees just because of this issue. Mr. Speaker, the members of the county executive, they have been paying medical care, their medical care or medical bills out of pocket. for the last 6 to 6 months, Mr. Speaker. So, Mr. Speaker, a lot of attention has to be given to this matter, and we require those who have been invited here, they need to be honest. We need to have an honest conversation on really what transpired. Mr. Speaker, the other concern is in regard to the restrictive and discriminative. Mr. Speaker, you can imagine.
Just a minute, Honorable Mike. Maybe it will be prudent when those concerns you direct so that the parties, because we will ask the parties to answer those concerns, so that the concerns that have been raised, like the one I have captured, one on tripartite, the CCs should give us that position. So others, as you raise, then the parties, it would be important to attach the party that will now give us that clarification. Okay, go ahead.
Thank you, Mr. Speaker. Mr. Speaker, most of the issues I'm raising, they will be revolving around the tripartite agreement. So, and I'm sure the three parties, they will have to share with us their stories in regard to those issues. Mr. Speaker, you can imagine some staff cadres in this response, they were to visit a facility once in a month, and they were to utilize only 2,450 shillings. Mr. Speaker, you can imagine some of the facilities, some of the best facilities in the country, they were regarded as a no-go zone to some of the cadres of staff, Mr. Speaker. Mr. Speaker, we would want those issues to come out very clearly, whether they are in the SRC circular, the one that has been mentioned here, or they are in the tender document requirements issued by TCG. Mr. Speaker, for the case of the tender documents requirements issued by TCG, we would require the same documents to be tabled for evidence, so that as an house, we see whether it is in those tender documents specifications that issues, restrictions, and discriminations noted in the service delivery were part of those tender documents specifications. Mr. Speaker, that will be very key, because looking at the benefit structure by job group as per the SRC circular, we don't have such discriminations, Mr. Speaker. Mr. Speaker, we would require that to be tabled so that we see where the problem was, whether it is in the tender documents or not. Mr. Speaker, we are surprised in the way the Turkana government is managing the affairs of the employees. Mr. Speaker, looking at this question on the measures being undertaken to address the disparities and ensure equitable access to medical services. Mr. Speaker, as alleged by the County Executive Committee member for Public Service, he says up to now, even after his communication with both Jubilee and Transnet, there was no feedback out of all those communications he made, Mr. Speaker, so meaning there were no resolutions which were made to address the disparities and ensure equitable access to medical care. So meaning, Mr. Speaker, the Turkana County government failed to represent its staff. Mr. Speaker, as a policy holder, the Turkana County government would have terminated the contract, Mr. Speaker. Mr. Speaker, how do you fail to represent your staff and your staff have gone for 6 to 7 months without getting the medical care, Mr. Speaker? Mr. Speaker, I see that that was a failure on the side of the county government of Turkana. Mr. Speaker, to me, this is a case of a county government that is dancing on the graves of the dead. Because a county government that is not sensitive to the welfare issues of its staff, how are we going to term such government, Mr. Speaker? Mr. Speaker, the introduction of a broker for medical insurance is a scheme orchestrated to deny employees of this county government their medical benefits, Mr. Speaker. Mr. Speaker, in fact, I'm even worried whether we are addressing the right persons or not. Mr. Speaker, we were expecting the directors of Transnet. We were expecting them to be here. So, and they only decided to send us the general manager. So, Mr. Speaker, I don't know whether the general manager has any information in regard to the issues we are raising. Mr. Speaker, going forward, I beg your chair to ensure that we have the right persons being invited to engage with this house. We were expecting the directors of Transnet, because all along they have not been honest in dealing with us, Mr. Speaker. Mr. Speaker, as I conclude, I would want to confirm from the County Executive Committee member for Finance and Economic Planning whether full payment of the premium to the underwriter has been paid, especially now that there has been no provision of medical cover, a period that has been said to be a temporary suspension of the medical cover. We would want to confirm whether full premium has been paid, Mr. Speaker. Mr. Speaker, if that has been paid, we would want Transnet and Jubilee Insurance to share with this House the names of the county executive employees who have so far been reimbursed, because the general manager of Transnet talked of even in the period of suspension of the medical cover, they have been doing refunds and reimbursement to those who have been receiving medical care from some of the facilities. Mr. Speaker, the general manager for Transnet has alluded that in the period of the temporary suspension period, they have still been providing services during this period. Mr. Speaker, we would require the general manager to be honest herself. Mr. Speaker, we've been in this county. Some of these county executive employees, they are our relatives, Mr. Speaker. So, and there is no way that Transnet will claim that they have been providing services to the county executive staff during the temporary suspension period, Mr. Speaker. Mr. Speaker, this is a blatant lie, and we cannot accept that, Mr. Speaker. Mr. Speaker, there are these people we've lost during this period. Mr. Speaker, I don't know what is their take in that. I know there is that arrangement of the last expense, but some of these people we've lost, it's attributed because of the temporary suspension of the medical cover to our county government employees, Mr. Speaker. Mr. Speaker, something has to be done in this regard. I know I have a number of key recommendations, but I will get time later to give some of these recommendations. Thank you, Mr. Speaker.
Thank you, Honorable Mike. CC Public Service is issues of tripartite agreement, the cover during suspension. So, welcome, CC Public Service.
Thank you, Honorable Speaker. Honorable Speaker, during the temporary suspension period of the medical service, Mr. Speaker, my office wrote a commitment letter to Transneb and Jubilee, and particularly Transneb. And that was during the time for supplementary budget, Mr. Speaker. The services had already was stopped, but we did our commitment letter that after the approval of the supplementary budget, we will settle down the pending premiums. But they responded negatively that we will only give the service on condition that you settle the pending bill, Mr. Speaker. Mr. Speaker, the termination period is not the seven months. The cover was closed by December 2025. Mr. Speaker, the signed tripartite agreement between Jubilee, county government, and Transneb, and particularly on the side of the county government, was with the best interest of protecting the interest of the county government and its employees. Lastly, Mr. Speaker, on the tripartite agreement, allow me, Mr. Speaker, to bring in my chief officer. Allow me to bring my chief officer to explain on that. Thank you, Honorable Speaker.
Okay, Chief.
which was open in line with the Insurance Regulatory Authority and in line with the Public Finance Management Act and in line with the PPRA. An award was, the cover was awarded in May of 2024 as a tripartite And the contract was signed in June of 2024 by Jubilee Insurance, the Transept Insurance Broker, and the county government of Turkana. I want to clarify here to members that I joined the department 7 months later in the month of November. And when I went through the document, I totally agreed that the guidelines by SRC, the laws that are in place in matters insurance, the primary healthcare guidelines, the primary healthcare guideline of 2021 and the Primary Healthcare Act of 2024, which protects individuals on matters how we receive health services, were adhered to as per the documents I found in office. On June of 2025, our cover was coming to an end, and we all know that the budget this house allocated for insurance was not enough for the staff we had. The amount we had was 265. The first cover, we had approximately 5,400 staff. When we looked at the staff that we'll have in this new cover, we renewed the cover with an approximation of a staff of 5,900. And this means 5,900, each individual will have 1 spouse and 4 dependents. So if we multiply that, we can all get the figure. However, as we stand now, the county government of Turkana, we have 6,300 in staff. But we are still sticking to the figure we paid for 5,900. At that particular time of renewal, Chair and honorable members, we did not have enough money. We only had 265. That if we advertise, no one will be willing to take a cover on credit. The cover that was initially given was a 1-year cover renewed based on performance. Members in this house, you can agree with me that during that cover, we had no issue. And it is in that basis that we decided to renew the cover. And during our consultative meeting after the renewal of the cover, Jubilee said that we need to agree in writing what time will the county government of Turkana pay. And they wanted us to pay the balance of 160 million by July. It is with my negotiation and the then County Executive Committee member for Public Service, Administration and Disaster Management with the technical team, both from legal, from human resource and finance and procurement, that we agreed July will not be possible because when we look at matters budget opening and all that, so we pushed it to September 15th. And on the September 15th, we were not able to pay because of issues of supplementary. The Department of Public Service wrote to Jubilee Insurance requesting that they extend this agreement of payment of 15 September with 1 month, with the belief that within the 1 month, the budget will be open and we will be able. This was accepted by Jubilee. On October, we were not able to pay. We again wrote another letter as a department to extend it with another 1 month. On the month of November, we were not able to pay. We requested for another extension up to end of November. And I remember very well, at the beginning of December, we wrote another letter as the Department of Public Service, which was declined by Jubilee, and their concern was, this is the 4th request you are writing to request for an extension of payment. We therefore now do not trust the department. We want to get a commitment from the County Executive Committee member for finance and economic planning. And on 9th of December 2025, CEC Roslyn Aite wrote a letter requesting for an extension to 5th of December. My communication and that of the department with Jubilee and Transept was that considering it is the end of the year, they have audits, they have statutory stamps they need to pay, that will not be possible to wait until 5th of December. It is on that basis that the cover was closed. The cover was closed on 12th of December, and Jubilee are here, they can agree with me. The cover was closed on 12th of December. On matters treatment, yes, Chair, as the Chief Officer in charge of Public Service, I can agree that admission cases have been treated, and I know of an example of a person treated in ICU when the cover was closed. And I personally wrote that letter to Jubilee requesting that this is a critical case they need to treat, and the dependent was treated in a hospital in Nairobi. Thank you, Chair.
CC for Finance.
Point of information, Honorable Speaker.
Honorable Liwo.
Thank you, Honorable Speaker. Honorable Speaker, this House is a House of rules and procedures. And the county executive members present here today and the Jubilee, the insurance representative present in the House today, Mr. Speaker, are attempting to give us information. But what is trying to maybe not come clear from them is that there is a lot of narratives that we are given. When they are saying they made a correspondence between the department and the insurance, for example, then they are supposed to table the evidence of the letters of correspondence between them and the department and the insurance. There is a possibility that we are fed on narratives that are not true, that are not clear, and they are not evidence-based. So because it is easy for anybody, Mr. Speaker, to raise and say, we talked, we wrote, we said, and we did. Why are they not providing evidence that when you say, we wrote the first letter on 10th, for example, September, then provide the letter to the clerk so that it goes to, it becomes an evidence that there was a communication that was made by the department to the insurance. So that we now see where is the problem. We dissect where the problem is and where there is no problem. Thank you, Mr. Speaker.
Thank you, Honorable Liwo. As we did in the first instance with the letter by the CC, which I have also seen, it is the letter from the county secretary, which is still all right. I still direct that the letters of extension, the letters for request of extension by the public service, whether CC and chief officer, then the letter that was written by the CC finance and economic planning for the last extension, then the reply also from the insurance, the Jubilee insurance, that now said, no, we are not taking any further extension request. So those concerned, we require those letters to be tabled so that we can also photocopy, so that the members have a few over them. If they are still in your laptops, they can be printed. Catherine, those letters can be printed and be brought here. You know, some of these things speak for themselves. When we say we did this, if we have those letters, we would ask very few questions because that transaction was there. Honorable Payo, you are negating what the speaker has directed?
Honorable Speaker,
okay.
You've directed well. However, you know, when we say you print from the computer, it could be something that is written and it's not genuine. Maybe we print from the emails or letters that have been rubber stamped for that purpose. Thank you, Honorable Speaker.
Of course, we need an authenticated document like this one. The one we have here as a rubber stamp from the county secretary. So, but get us the documents.
Point of concern, Honorable Speaker. Or information, Honorable Speaker.
Information on which standing order?
Honorable Speaker, of course, standing order number 101 on statement of facts, Honorable Speaker. Honorable Speaker, I don't want to quote that standing order, but let me quote the Constitution of the Republic of Kenya, Article 196. Mr. Speaker, that article of the Constitution stipulates on the mandate of the parliamentary committees. And one among the mandates of the parliamentary committees or assemblies is to ensure that the person who is attending a session of the county assembly might be compelled to produce the documents. Mr. Speaker, this is an equivalent. The county assemblies has been equated to the High Court, Mr. Speaker. I want to just take you back, Honorable Speaker. Last time, when we were deliberating with the CC for Public Service, one among the documents which we requested them to provide to this county assembly is the signed contract agreement between the county government of Turkana, the Jubilee Insurance, and Transnet, Honorable Speaker. Honorable Speaker, if we have that document with us, we will see the terms and conditions of the contract, Honorable Speaker. And it is through that document, Honorable Speaker, that we will probably agree on the responses that is being given by either party. Because if you can't go through the terms and conditions of the contract, I think we will be just tousled left, right, and center. So I will still request through your chair that the signed contract agreement between the county government of Turkana, Jubilee Insurance, and Transnet be tabled before this honorable house so that we could see where the terms were not honored, Honorable Speaker. Thank you.
Honorable. Thank you, Honorable Speaker. I'm also rising on a point of information. When we started this session, I wanted to rise on a point of order, but because we are discussing a very serious matter, which involves the lives of the people of Turkana, I decided to let it go because under question time, Honorable Speaker, our standing orders are very clear. The CCMs are supposed to answer questions in this chamber. But today, we have people from Transnet. I don't know which CCM is that one. We have somebody from Jubilee. And again, we allow the chief officer to respond. And yesterday we said, under question times, there are CCMs who are supposed to answer questions in this chamber. Honorable Speaker, these are weighty matters that we are discussing. In my opinion, normally, as the procedures of this House, we should allow the committee responsible in this House to deal with this matter so that they can summon witnesses and provide evidences that we require. Because we will be treated into these write-ups with no evidence, with nothing at all. Because in fact, Honorable Speaker, I'm one person who has been confused with these written submissions. Because the Jubilee are mentioning they have signed a contract with the county government. I haven't seen them mentioning Transnet. I've seen the CCM for finance. The contract was between Jubilee and the county government. There is no broker in between. The CCM for public service and administration said it is a tripartite agreement. So, Honorable Speaker, these things are getting some of us confused. So, was the agreement tripartite or it was between the county government and Jubilee? So, Honorable Speaker, in my honest opinion, we should allow the committee, which is chaired by the able leader, member of County Assembly for Lobogat, to deal with this matter precisely, to request to summon witnesses so that we get this very crucial information, Honorable Speaker. We get these letters, the correspondence between the departments, the correspondence between CCM Finance, CCM Public Service, from CCM Public Service to Jubilee, and so that that is where we will get light on what happened. But Honorable Speaker, that's why I say in the first place I decided let's interrogate the matters. But things are coming up. We are not getting clear information in terms of evidences. You can see even the agreement, we don't have it. It should be part of the annexes. Even those correspondence should be part of the annexes, so that as we ask these questions, we have enough information, Honorable Speaker. Otherwise, that is the information I wanted to put across. Thank you.
Information.
Honorable Zelina.
Asante sana Mheshimiwa Spika. Ningependa kuambia wenzangu kuwa sisi wenyewe tuliandika barua tukaandikia watu wa Jubilee kuwa tusummon ndani ya ile nyumba. Na wanafaa wajibu yale sisi tulikuwa tunahitaji. Hatuwezi sema ni ministry wajibu peke yao. Wao tena wako na ujumbe fulani ambaye wako naye, lazima watuelezee. Hatuwezi fungia nje wasiongee. Asante Mheshimiwa Spika.
Okay. Okay, I will listen, then later I will give my direction on Leader of Minority.
Thank you, Honorable Speaker, for this opportunity. I just want to join colleagues for giving their informations. And I want to believe that today we are on a serious business. Our people are waiting us out there. Because, Mr. Honorable Speaker, the matters of medical care, it is so important in our people. And what we require here, as the honorable members, it is information. Whether it is a Jubilee person, whether it is Transnet, I don't know, LT something, and others. Let's allow all these officers to give us information, because what we require, it is information. And Honorable Speaker, we are trying even to drag this motion, because the issue of information, to me, the issue of letters, it might be here or it might be brought later. But good enough, the Jubilee and Transnet are here to defend themselves. Because the letters that has been mentioned by the chief officer, the Jubilee are here to say they received the letters or not, as we wait for the other evidences, so that we allow this process to go on. Because, Mr. Speaker, now we are stuck, just because of small things. So, Mr. Speaker, can you guide the House so that we proceed? Because we still have so many questions to ask the Transnet, the County Executive, and the Jubilee. Honorable Speaker, thank you.
Information, Honorable Speaker.
The last information from Honorable Abdi Fattah.
Thank you, Honorable Speaker. I tend to agree with the Leader of Minority. Honorable Speaker, I kindly request the honorable members to allow this session proceed the way it was planned. If we allow or delegate this duty again to the committee, we'll be dragging this issue behind. And issues related to health are very important. We do not have to delay the whole thing. I remember last time we had written letters to these agencies demanding them to submit certain documents to this Honorable House. And Honorable Speaker, I believe they have the documents. It's only that we do not want to allow them, deliver them to this Honorable House. Honorable Speaker, yesterday, we agreed that the Chief Officer has no mandate to respond to any responses if the CEC is available. For anything that they will want to, any response that they will want to relay, then they should pass it through the CEC. The insurance and the CASNEP officers available here are visitors to this Honorable House. They have a room to talk. We cannot restrict them. But the department, they have their person or responsible to be answering questions from this Honorable House. So the Chief Officer should give the responses through the CEC. That's what we advised yesterday. And I think we should replicate the same today. Thank you, Honorable Speaker.
Okay, I guide that we allow the CC Finance, we allow the representative from Jubilee and Transnep to respond to concerns of Honorable Mike. Then later, we ask the questions we would wish to ask to the parties that will be there. Then we will come to a conclusion on the way forward. And the business of today is a resolution of this House. So you cannot give a resolution of this House, then later you want the Speaker to go against what you made. So, CC, Finance, the concerns from Honorable Mike.
Thank you, Honorable Chair. Speaker, the question was to let the House know whether payments have been done in full to the underwriter. I want to confirm to this House that on 9th of July 2025, 265 million was paid for insurance. And on March 2nd, 2026, we also paid 144 million. We have a balance of 16 million that has not been paid, but this is due to the budget constraints, because when we did the supplementary, we had provision for 160. When the supplementary was passed, that money was slashed by 16 million. So that is the only money that is due to the underwriter. Thank you, Honorable Speaker.
On CC, you wrote a letter to the Jubilee. Can you tell us what is the position of the letter of extension?
Thank you, Honorable Chair. In terms of the letter, as Chief Kadra has clearly informed the House, yes, she had informed me. She called and said that they have been doing letters to Jubilee Insurance because we were supposed to have cleared the 160 million, the balance, by 15 September. We all know the time we brought the supplementary budget to the House, it dragged, we finalized. By the time we were able to access that budget, that was in January, late January. But we had to write a letter, a commitment letter to them, and I wrote that letter on 9th December, seeking for the understanding because the supplementary budget had taken long to be approved. And because of the concern we had for the staff, and knowing the timelines that had already passed, that is why we did a commitment letter, because they had reached out to her and said they can only take a commitment letter from the CC Finance. And because of that, I did the letter to them on 9th as a commitment that once we finalize with the supplementary budget, we'll be able to undertake the payments. It was so unfortunate, even after they advised that we do the letter, they actually wrote a declining letter to us that they will not be able to extend the insurance until we pay the remaining balance. And I'm sorry, Mr. Honorable Chair, we'll be able to give that letter for the members. Thank you.
Jubilee.
Information, Honorable Speaker.
Proceed, Jubilee.
Thank you, Honorable Speaker. I would wish to respond to the matter of the temporary suspension of the cover, which happened on the 12th of December last year. The Insurance Act, CAB 487, of the laws of this republic, read together with the amendment number 11, the Act number 11 of 2019, forbids any insurer from assuming risk before collecting full premium. In essence, the regulator who regulates our industry and regulates and licenses Jubilee Health Insurance has issued a guideline that until a full premium is paid, the insurer cannot assume any risk or any contingency thereof. Notwithstanding this fact, we've had a long-standing relationship with the county government of Turkana. This is, as correctly mentioned by the Honorable Member, this is not the first time that we are insuring and providing medical insurance cover for the employees of the county executive. And also understanding the cycle of funding that the CEC Finance has mentioned regarding budgeting and supplementary budgets, we did make a concession, and this would be because the regulator demands that the insurer assumes liability if and only that they can be able to service the claim, which is provided for by having enough liquidity, which makes you a solvent underwriter. The advantage of Jubilee Health Insurance is that we are solvent and we could be able to carry and pay claims and offer an extension period for the payment of premium. We did so, and we agreed that this would be done on the 15th of September, and I'm sure the correspondences will be tabled before this Honorable House. Up until December, we had extended the request by the county executive thrice. We are a strictly regulated business, and we maintain very stringent guardrails on capital requirements and solvency requirements so that we are able to meet our claims obligations. Unfortunately, it was untenable for us to continue servicing the scheme, paying claims to the hospitals when we had not received full premium. In essence, we had assumed risk before receiving the full premium based on our strong solvency, but it was starting to impact our operations for this particular policy. You will also note, Mr. Speaker and honorable members, that payment has come in March of 2026. This is 6 months from September 15th. I understand, and Jubilee understands, the budgeting cycles and the constraints that those can avail to the county executive. But this is regrettable in the sense that we have had this, provided this cover for the past 3 years, and we've never had a period of suspension. And we've always provided for a staggered payment plan for the county executive. This is the first time that was missed. 2023, 2024, it was October, we were paid in October. 24, 25, it was November, if I recall correctly. And so, whereas Jubilee would, in good faith, extend coverage, our hands are tied in dual manner. One, from a regulatory perspective, and obviously from a cash flow perspective, that we are able to service our claims, our liabilities. Mr. Speaker, with your permission, I'd also like to respond to the question on provider restrictions and the capping of visits to once a month or to a limit of 2,400. And allow me to, if you'd indulge me, Mr. Speaker, with your permission, to just give a bit of a background. We contract medical facilities based on different levels of service that they offer. So from what is gazetted by the Ministry of Health, the policy guidelines from level 1 all the way to level 6. And each of these facilities are able to provide services within the ambit of their licensing requirements. And we do contract these facilities in different manner to ensure that they can be able to service our members and we can be able to meet their payment obligations on time. One of the ways we contract these facilities is on a reimbursement on a moving average basis. If your average cost last year, for example, was 3,000 shillings, we sign a contract and we will reimburse you 3,000 on average for the following year, of course factoring in inflation. However, Mr. Speaker and honorable members, and I would request the indulgence of the House to support us in this matter. And allow me to make an aside that it also affects you, honorable members and Mr. Speaker, because we've been privileged as Jubilee Health to provide coverage for you, honorable members. More often than not, and most times, we have found that many providers would tend to go around that arrangement to maximize the compensation that we pay out. For example, if you've agreed that you're going to pay 3,000 shillings per visit, then instead of, because ideally what that means is whether the visit is 5,000 or 800 shillings, I will pay you 3,000 shillings. So instead of us adhering to that agreement, we maximize the number of visits. So I'll tell you, go and come back tomorrow. I'm sure you may have heard of such scenarios. Or you pick your prescription here, go get consultation from another place. It is unethical, it is inhumane, it is fraudulent, and it is outright theft. Honorable members and Mr. Speaker, whereas Jubilee Health is a law-abiding citizen, a law-abiding corporate citizen, and a diligent taxpayer, we take it very seriously for us to be able to safeguard our fiduciary duty towards safeguarding public resources. And therefore, you will find that there are many providers. Mr. Speaker, honorable members, you will find that our surveillance of our provider panel is continuous, and often you will find that there are providers that we will add, and there are those that will be suspended from time to time as we address those administrative matters. Allow me also to mention, Mr. Speaker, honorable members, that our preference for service provision continues to remain, and we've championed this since we came on board to provide this policy. Our priority has always been to ensure that we onboard the county facilities so that the investment the county executive has made into providing the medical cover for the staff is reinvested back. And happy to say here that we started from zero 3 years ago. I think last year Jubilee Health paid about 25 million or so to to Lodwar County Referral Hospital. I beg to submit at that point. Thank you.
Thank you. Transnep.
Thank you, Mr. Speaker and honorable members. I wish to respond to a few queries regarding the broker, and to start by just confirming that by being here as a general manager is based on handling the medical business by training, and yes, understanding the Turkana County government medical scheme for the last 2 years. So just to give you comfort that you have the right person who understands the operations and what is expected of the broker. So one of the honorable members who asked if we can be honest about reimbursement. Yes, Mr. Speaker, sir, only that under the data protection, I may not give the names, but we can give the numbers, and we are happy to do that, give the cases that have been reimbursed. Of course, we gave the requirements, what is needed for reimbursement, and we can also give the cases, including the ICU case. We may not give you who was suffering from what, because again, by law, you will not be discussing private medical information about clients and the who, but the numbers are there, and we can proceed, we can submit. The question on the pay out of pocket, I think that we have, given that the reinstatement was done in March, so immediately after we shared what are the requirements, and we have members reaching out to us, so we've been giving the information. So between the time it was reinstated and now, we can give that. Then, Honorable Speaker, I would want to speak to a letter that was alluded. What you have from the county secretary is what we received. There was no letter from the CC PSM. The letter was from the county secretary, and we responded. And also that will be provided. It was sent to Trustnep. It was not from the CC. We responded, and actually it was, the request was to understand the LCT and the operations. And like my colleague has explained that it's a platform that we used, our intention was, we actually asked for a meeting, which was intended to be even a tripartite, to even meet the service providers on the ground, because they're the ones who are providing the services. And just like what Dr. Musa has mentioned, the contract is with the underwriter and the facility. So we wanted to meet also the service providers to understand the pain points while serving the clients, yet there was an agreement on how the services will be given. So the same letter was shared, and we shall be able to provide that. So just to clarify to this honorable house that we have been responsive when especially the matters came up regarding the particular information that has been responded to. Yeah, that will be my submission, Honorable Speaker.
I now open the floor so that we can ask specific questions to specific invitees, so that we get to know the understanding and the operations on our concerns. So I will open the floor. I will begin with Abdi Fattah.
Thank you, Honorable Speaker. Honorable Speaker, I have so many follow-up questions in regard to the status of the engagement the county government had with the insurance company. My first question comes on the procurement process. Honorable Speaker, I'm asking the department, when did the County of Turkana engage the Transneb Insurance Brokers Limited? Question number 2, under which procurement method was the contractor engaged? Was it on open tender, restricted tender, or direct procurement? That regards that. Question number 3, was the procurement advertised publicly as required by law? And if yes, can the executive table the tender advertisement documents, evaluation reports, and the award letters? Question number 2 on contractual terms. What is the value of the brokerage contract? What is the value of the brokerage contract? Number 2, what percentage commission does the broker earn from the insurance premium? Number 3, what specific services does the broker provide that were not previously provided by the insurance company? Number 4, was the broker introduced when the county already had direct engagement with the Jubilee Insurance Company there before? One question on ownership and conflict of interest. We want to know who are the directors and the shareholders of the Transneb Insurance Brokers Limited. On the same note, can the executive table the CR12F certificate from the registrar of companies showing the ownership of the firm, that's Transneb company? Then, are there any of the county executive committee members, chief officers, or senior county staff, or any top county authority in the Turkana County government directly or indirectly associated with the company, that Transnet? Has the county undertaken conflict of interest declaration for officers involved in the procurement, if any? Lastly, on the legal compliance, was the contract gazetted as required for major public service arrangements? Was the county assembly informed or approved, sought before implementation? Lastly, was there public participation regarding the restructuring of the county staff medical terms? That's all I had, Honorable Speaker, in regard to the concerns of today. Thank you.
Just a minute, Honorable Anaklet, and we are now at 11:52. And given the representation in this house, I want to say, somebody who wakes up, kindly ask, go direct to the question, and ask as fewer questions as possible. So we'll time people 2 minutes. Honorable Anaklet.
Thank you, Honorable Speaker. Honorable Speaker, thank you for your direction. Much as I respect your direction, Mr. Speaker, I was a seconder in this issue. And therefore, Mr. Speaker, you'll have mercy on me and add me some more minutes.
1 minute.
Okay, thank you, Mr. Speaker. Let me try. Mr. Speaker, let me start with the Jubilee Insurance Company Limited. Mr. Speaker, I went through the response by Jubilee Insurance Company last night. And from my reading of that response and from my understanding and maybe my listening to the representative of Jubilee, I find the response a bit genuine, but I have maybe one question for Jubilee. And my question is, are you aware that you have a third party called Transnep insurance broker, being a go-between Jubilee Insurance Company and the Turkana County government? Because reading your body language, representative of Jubilee Insurance, it's like you don't have a broker in between, and you even don't know the existence of Transnep. Maybe you'll need to clarify that. And if there is a broker in between you and the county government of Turkana, why did you decide to entertain a broker to mediate or the health cover between of the Turkana County government employees? Because from my experience, it is possible to deal directly with the insurance company instead of having a broker in between. Mr. Speaker, I don't know, I have a lot of questions. Do I just leave these questions because of the issue of time?
Ask a few.
Or then
the
clerks should stop putting on the lights.
Okay, then you just go straight to the questions. You know, you give a background and you take time on questions.
Mr. Speaker, there is a correlation between the county government of Turkana and Transnep, and we'll need to understand that correlation. Because even from the response of the CCM public service, the response is related to the response given by Transnet. So we'll need to understand what is the correlation between the department and Transnet. Mr. Speaker, in question 1, the status of engagement between the county government, and it's unfortunate the question by Honorable Michael Eoi was not answered on the issue of tripartite agreement. Mr. Speaker, question 1 says the status of engagement between the county government, the insurance provider, and the insurance broker. That the county government entered into a formal contractual arrangement for provision of comprehensive medical insurance. And we have all those stories. My question on that will be, Mr. Speaker, was it necessary to have a tripartite agreement and introduce a broker? Between 2013 and 2022, during Honorable His Excellency Nanok's government, there was no such a thing. So at what point did this regime saw it fit to introduce a broker? Yet things have been flowing well since 2013 up to when this regime came. Would want to understand that, Mr. Speaker, and what informed the introduction of the insurance broker? Was it a genuine concern and interest of the employees of the county government, or it was an avenue to siphon resources for this county, Honorable Speaker? The CCM said the broker facilitates policy policy placement, provides advisory services, and ensures coordination between the county government and the underwriter. And that the underwriter assumes insurance risk and provides the agreed medical benefits to eligible staff. Mr. Speaker, my question is, looking at the roles of the broker.
Honorable Adler, take your seat. Leader of majority.
Thank you, Mr. Speaker. Mr. Speaker, I rise to move a procedural motion that notwithstanding the provisions of Standing Order number 35-2, this House resolves to extend the sitting hours till we conclude business in the order paper. So, Speaker, we are discussing very pertinent issue of insurance of the county staff. That is why we request for the extension of time so that each and every member of this House contributes, because it is out of that we will understand, we will get to the bottom line of this issue of insurance. So, Speaker, staff are dying. I cannot be able to mention names. It's a serious issue. We are shocked. We have listened to even the insurance company. We have listened to the broker. We have listened to the 2 CECs. We have listened to the chief officer, and we have realized there are so many issues that are not being addressed. Even without them tabling correspondence, the memos, we have realized we have to discuss a lot of issues here. And that is why we require an extension of time so that we handle this issue squarely well. I've listened to the insurance representative. He's intellectually acute, and I would like to listen more, and even the honorable members would want to listen more. We're discussing about the insurance, and we want to contribute immensely to this debate. Mr. Speaker, we need more time so that we ventilate on this matter. We have a government led by His Excellency President William Ruto, and on top of his agenda is issues of health. And in the county, we cannot be able to compromise standards of health, and we cannot be able to continue losing our staff. These are our people, and we are here to represent our people. In case of very sensitive issues, they are not able to talk, and we will talk on their behalf. Mr. Speaker, we'll have time to ventilate immensely and come with the resolutions that will help this county handle the issues of insurance seriously. With those few remarks, Mr. Speaker, I want to call upon the leader of minority to second this procedural motion. Thank you, Mr. Speaker.
Leader of minority.
Thank you, Honorable Speaker. Honorable Speaker, I want to take this opportunity to thank the Honorable Leader of Majority for reminding us about the time, and he has gone ahead to mention about our standing orders number 35. If you can go 1 and 2, it will all indicate our programs. And Honorable Speaker, as we know that our sessions are supposed to end at 12:30. especially during one-day session. And Honorable Speaker, what we have today, it is very pertinent issue, and it is issues that are being weighted outside there. And Honorable Speaker, since we have not even started asking our question, we have just started the first member. We still have almost all of us to ask question. So, Honorable Speaker, I just want to ask colleague, we extend our sitting until we conclude this matter, so that we want to, by the end of today, our people outside there will be celebrating. And Honorable Speaker, we want to make this matter once and for all. We conclude, because what we know, the matter of health care, it is very important in our people. And all of us, we want to live a good life. Honorable Speaker, having said that, I want us to sit as I second this motion and ask colleagues to approve this procedural motion. Thank you.
Thank you, Leader of Majority, Leader of Minority. Now I propose the question that this House extend its sitting until we finish the business in front of us. I now put the question that this House extend its sitting until we are done with the business in front of us. Will as many of that opinion say aye? Aye. Will as many of the contrary opinion say nay? The ayes have it. Honorable Naklet, proceed.
Thank you, Honorable Speaker. Honorable Speaker, before I was interrupted, Mr. Speaker, I was speaking to the roles of the broker, the functions of the broker, issues to do with the policy, issues to do with advisory, issues to do with coordination between the county government and the underwriter. Mr. Speaker, looking at these roles are roles that can be effectively undertaken by the CECM and the county chief officer. These people, Honorable Speaker, have been employed and are paid a salary to carry out these tasks. Why again do they have to relinquish these functions to a broker, Honorable Speaker? Yet they are paid to carry out these functions. And by relinquishing these functions to a broker, Mr. Speaker, the county government incurs a lot of costs, can say double cost, paying them salary and again paying the broker, Mr. Speaker. That is a misuse of resources, Mr. Speaker. Mr. Speaker, the CECM says that this partnership was established to guarantee access to quality, affordable, and equitable health services for county employees. My question is, Honorable Speaker, is this truly the case? Because if the employees of the county executive have not been getting services, Mr. Speaker, there is no way we can be told that the broker is important because the presence of the broker assures quality and affordable and equitable health care services. That's neither here nor there, Mr. Speaker. Mr. Speaker, there is something called outsourcing. You only outsource when maybe you are overwhelmed. You only outsource when you want to have efficiency in service delivery. But now, when there is no efficiency, the staff of the county government are not getting services. I mean, there is no efficiency. So the presence of the broker is not therefore necessary, Mr. Speaker. Mr. Speaker, our staff working with the executive are getting services from backstreet health facilities. I have a case in point, Mr. Speaker, where one of the employees went to MTRH
in Eldoret and was denied services, Mr. Speaker, and instead was referred to a backstreet facility on your way to, there's this road Honorable Kalima usually uses, Ravine. You know, there is that road going to Ravine. There's a facility there called Living Room. That's a backstreet facility, Honorable Speaker. How do you deny, I mean, the staff of the county government of Turkana access to services in a noble facility called MTRH in Eldoret, and you refer them to a backstreet facility, Honorable Speaker? Mr. Speaker, the CCM said the engagement remains operational within the terms of the executed agreement and subject to periodic review in accordance with procurement laws, SRC advisories and contractual obligations. Mr. Speaker, my question is, considering that the staff of this county have been crying about medical insurance since this regime came to power, how many periodic reviews have you done? And if any, why haven't you actioned any changes to this agreement to address the plight of the staff? Mr. Speaker, we've been told that there was a meeting, I don't know, in Ateker on 8th of October, and there was the Jubilee Insurance was to provide a response. Until today, no response. I mean, we need to be told, and Jubilee should be able to tell us why hasn't there been any response to this moment. On question 2, the policy framework guiding medical benefit capping for county staff. The CECM Public Service said medical insurance package adopted by TCG is structured in strict adherence to SRC circulars, guidelines. I heard Honorable 𝐂𝐒𝐄𝐿 saying that some documents be tabled. Mr. Speaker, we've been hearing about the tender, tender specifications or something. Those documents, the tender document specifications, those documents need to be tabled, dear Honorable Speaker. And the contract between the county government and Jubilee Insurance needs to be tabled, because with those documents we'll be able to see what exactly is in those documents. And it will be prudent even for them to take us through key highlights on the terms of those of the contract and the terms of the tender document specifications. That will be very important. Mr. Speaker, if SRC guidelines apportion outpatient benefits for each job group, and we also that schedule where every job group has been assigned for inpatient, outpatient, and dental and optical, we also that schedule. But now, why are patients being paid? Why is the payment capped? That you only get treatment up to a maximum of 2,450 or 2,500 thereabout. That needs to be clarified. The CCM on tripartite contracts signed between TCG, Transnep, Insurance Broker, and Jubilee Health Insurance Limited. In the last paragraph, you say, the contract ensures accountability, transparency, and effective service delivery in the management of the county staff medical insurance scheme while protecting the interests of both the county government and its employees. And Honorable Mike asked a very pertinent question. Whose interest?
Concluding, Honorable
whose interest?
Concluding.
Yes, I'm concluding, Honorable Speaker. Let me try. Whose interests are you taking care of? Because here you are saying you are protecting the interests of both the county government and its employees. But from my observation, there is an interest that you are taking care of. Either your interest or the interest of the broker. That needs to be clear. Question 3, on measures being undertaken to address disparities and ensure equitable access to medical services. The CCM said a consultative meeting was convened between bringing together key stakeholders, and I think that's the meeting I was talking about. The meeting that we were being informed here took place in 𝐏𝐻𝐃. And my question will be, there are several other meetings that were done. Maybe it will be important you provide minutes to those meetings and any other important information about those meetings, because you formally engaged, and therefore there has to be something to show that you indeed did a meeting, and these are the things that you agreed. Much as we have a letter here by the county secretary, we need to also understand that. Now, on finally, Honorable Speaker, I think I have to skip some questions. When you are responding, you skipped question 3 and question 5 on why optical cover was removed for some cadres. There are some cadres where the optical cover was removed. Why? Maybe you'll need to explain that, Honorable CECM, and why St. Luke and MTRH and other health service providers were delisted. So you'll also need to provide an explanation about that. My recommendations will be, finally, Honorable Speaker, as I finish, Transnep is not necessary. So I would want to urge this House, as we make a resolution, having Transnep is a disservice to the employees of Turkana County Government, and we need to agree that we do away with the Transnep. If the insurance provider feels it can't provide services without the insurance broker, then we need to change the insurance provider. If Jubilee feels like they can't function without a broker, then we get another insurance company to provide medical cover to the employees of the county government of Turkana. The issue of reimbursement of staff, that needs to be done for the period that the staff have been paying from out of pocket. The staff need to be reimbursed. And maybe I will give Mike, if there is any other question, I will be. There was some contradiction between the CECM Finance and the CECM.
The time is over, Honorable Anaklet.
Thank you, Honorable
Yes,
Speaker.
let's have the rest.
Thank you, Honorable Speaker.
Thank you. Honorable Aburan.
Thank you, Mr. Speaker. Mr. Speaker, I would also want to contribute to this motion of the issue of medical. Mr. Speaker, my questions goes direct to the relation between the county government and the Jubilee. Mr. Speaker, from the response that have been given by the Minister Public Service, there was a meeting that was held in 𝐏𝐻𝐃 Hotel on 8th of October, and the directives were given by the County Secretary to the Jubilee over the same concerns that we are discussing here. Fortunately, the Jubilee didn't respond to the matter and leave those issues unaddressed. So I'm failing to understand, I myself, what was the cause of the Jubilee not replying to the issues that were told in that meeting. Yet, the Jubilee Insurance were aware of the issues that were raised by the staff of the Turkana County Government. Number two, Mr. Speaker, I have heard of the Minister for Finance replying on the payments that during her inception to the office, she has paid the Jubilee insurance about two times. That is on October and recently February, or March. And this problem has been there. Our people have been crying, the doctors have been striking, the community have been giving us a lot of questions over the issue of the medical cover. What was this? Because, Mr. Speaker, last week, part one, I had gone to one of the hospitals here in Lodwar, where I met a county staff, and I was also taking myself to that hospital. Wonderful. I was treated. My card was accepted. And that person who was working to the county government was denied the services. I failed to understand what is really going on. So, from my understanding, Mr. Speaker, I have seen this issue has been brought by this broker who is in the middle of the county government and the Jubilee, which is Trustnep. Because Trustnep, from his response, has been telling us is doing monitoring and delivery of services. Will Trustnep account for us, the people that we have lost during the period of 6 to 7 months? We have lost the lives of the people. Is Trustnep going to compensate the lives of these people that we have lost? They have lost their life. Lastly, Mr. Speaker, we need to look into this matter, because we had called these people earlier before, and they denied to come to this house. And they were even, from the information that we had, they were even trying, these middle brokers, they were even trying to put this house into two by doing bribes, by doing divide and rule. We are not, Mr. Speaker, going to accept that. This is a matter of county impotence, and it is a concern that we need to look into as the honorable members representing the Turkana people.
Point of order,
Thank you, Mr. Speaker.
Point of order, Mr. Speaker.
Honorable Bruan, take your seat. Honorable Leader of Minority.
Honorable Speaker, just standing in our normal standing order number 101. Mr. Speaker, when we are here, we were even trying to inform our CCM and the Trustnep and the Jubilee that we are here to give the truth. Is it in order for the member who was on the floor to say that the Jubilee was trying to bribe some members in this house, whether it is Jubilee or Trustnep? Is it in order, Honorable Speaker, to mention about that? Because what I know, according even our today motion, nobody who is ready to defend any Trustnep or Jubilee. So, Honorable Speaker, I think it is not in order. The member should withdraw that statement. Nobody who is being bribed. We are here to defend our people and to ensure they have gotten the right services, Honorable Speaker. Thank you.
Thank you. Honorable Member, you know this is a house of
I think, Mr.
honorable
Speaker,
members. You substantiate,
Mr.
provide
Speaker,
an
I
evidence.
was clearly...
Order. Take your seat. You substantiate, give an evidence, or you withdraw and proceed.
Mr. Speaker, I was clearly saying, we were calling these people earlier, and they refused to come. And what we hear, the Trustnep people were trying
trying to divide the house by bribing.
Honorable member.
That is what I was saying.
Honorable
and
member.
If it is like that, I withdraw that issue of bribery.
Okay, proceed, honorable member. Have you done? Are you done with your questions? Okay, Honorable Eliud.
Thank you, Speaker. I'm a bit dejected. For several instances, Mr. Speaker, when I stand, I don't know whether I'm opaque, because you tend to give other people an opportunity to speak, even when I have already stood on the floor of the House. Today, I decided to put on my sanity white so that I can catch you high. Mr. Speaker, this motion, as I said yesterday, still is a hot potato discussion we are discussing here today. It's a matter of the life of our people. I want to ask few questions, and I want to disregard the tripartite agreement in this House. It is null and void. I concentrate on the county government and the Jubilee. Mr. Speaker, as Honorable 𝐏𝐻𝐑𝐂𝐇 and the rest have just put it, I want to ask, the same Jubilee giving services to the County Assembly of Turkana, is it the same Jubilee offering services to executive staffs of this county, or is a different one? And if it is yes, Mr. Speaker, I want to ask the CC what necessitated this practice of subcontracting. If the Jubilee are doing a good job, a good service we are getting from this county assembly, what exactly has changed for the Jubilee to offer the same services for our executive staffs of this county? A second one, Mr. Speaker, I direct this to the CCM for Finance. The budgetary procedures in this House allocates money to contingent funds, including the medical funds, which are meant to cater the risks and other unforeseen developmental agenda. Today, we are here and she's saying the money were not adequate to cater for the rest of 6,300 staffs of this county. I may want the CEC to furnish this house with the segregated list of staffs that are eligible for this insurance medical cover of the social capital of this county, Mr. Speaker. Lastly, but not least, the questions, I direct this to the Jubilee. The Jubilee are doing a good job. We are also, all of us, enjoying the services of the Jubilee. Are you in any way sending a message to us as your clients that the Jubilee is incapacitated themselves to deliver or to offer services by their own, and call a subcontract to a third party in the name of Transnet or something like, I heard of LCT. And if so, I concur with the same recommendation of Honorable 𝐏𝐻𝐑𝐂𝐇 that this House will do away with the Jubilee services because they are now incapacitated to offer services for our people. The last one, Mr. Speaker, seemingly we need to look into our standing orders. Every other time we ask the CEC to come, some of the DCECs are being rotated in these departments. When we call the CECs to come, we also need to see the standing orders so that they come with the chief officers. These are all equal accounting officers. If the CEC seems like it doesn't have an adequate information, there is no law that is barring the chief officer who has the same information that can quench this house with the desired queries that is being asked in this house, Mr. Speaker. She seems to be knowing all the information about the tripartite agreement, how it was established. So any other time when you want to buy the information, we'll be getting a raw information from these executives. With those few remarks and questions, I say thank you.
Okay, thank you, Honorable Eliud. I want to make one clarification. Sometimes you can stand three, but my eyes lands on one. But then another time you can stand two, but one of you is a leader of this house. So I give preference, not me, but the presidents of this house. I give to the leader. So that is not being biased. It is the procedure that is there. Put your mic off.
Thank you for guidance, Mr. Speaker.
Thank you, Honorable Speaker. Honorable Speaker, the item of discussion today arising from a question of the county importance is so critical. And it's even more closer to the hearts of the employees of this county. I think far much better than even the one of yesterday, Mr. Speaker, because it deals with life and death. That if you bungle with the health service, then it means you are directly affecting the living standards of the employees of this county, Mr. Speaker. Mr. Speaker, I am guided by Article 43 of the Kenyan Constitution 2010 that says, Part A, that says, every person has the right to the highest attainable standards of health, which includes the right to health care services, including reproductive health care, Mr. Speaker. Mr. Speaker, if this is the supreme law of this country, Mr. Speaker, then it is the way it has been written, the way it has been put, Mr. Speaker. It is not segregative, because it doesn't segregate health to low cadre, middle cadre, to higher cadre, Mr. Speaker. So it means when it comes to provision of health, it is health and health and health for each and every person, Mr. Speaker. Mr. Speaker, the honest thing about the discussion in this house today is what Honorable Omodo said, that the county executive committee members present here today, they have turned to be very honest. And to me, when I was sitting, I saw that it's like the shoe wearer knows where it pinches. And this time round, he even knows how it pinches, Mr. Speaker. Mr. Speaker, the other time we invited the county executive committee member in charge of public service, administration, and disaster management. Mr. Speaker, he said he fell sick at Kakuma one day, and he went to a health facility, Mr. Speaker. Mr. Speaker, what transpired from there is the reason why he's too honest today in this house, Mr. Speaker, because he is a victim of the circumstance of capping and bungling of the healthcare service, Mr. Speaker. That is why he has turned very, very honest. Today, I think that is the good part of how things are running in this house today. I have a few questions, Mr. Speaker, despite the fact that it is turning yellow before even I start asking the first question. Mr. Speaker, when we are handling critical matters, sometimes we check on how the table clerks look at time, Mr. Speaker, because we need, this information is so crucial and so critical that it needs to go to the exact people at the day when they are invited here. They are not members of this house that we say, if this information does not well go to them today, they will be there tomorrow, they will be there tomorrow part one, or any other day easily. So therefore, when they are here, we can make sacrifice and better sacrifices so that we get responses that can be kept for some time and are helpful to our people, Mr. Speaker. That is why I want to request for a few minutes to ask a few questions here. The response from the county executive member in charge of public service, in charge of finance, and even the insurance companies, the two that are here, that is the broker and the Jubilee. All of them have said that the partnership between Jubilee Health Insurance Service Care, Transnet Insurance Broker, they are claiming that the intention is to provide the alleged quality, affordable, and equitable service delivery, Mr. Speaker. And we have always kept repeating this. Is Jubilee Health Insurance not able to provide the so-called quality, affordable, and equitable health service without the broker? So that should come clear from the insurance, that when this county decided to say it is giving Jubilee Insurance authority and authority to provide health service, then to me, I thought they were crystal clear that you have the capability to provide what is called quality, affordable, and equitable health care to the employees of this county, so that they are able also to provide quality, equitable, and fair service to the people of this county. So when now you come and say, all of you, the reason why you decided to bring a broker in between the employee and the employee and the employer, it's because you wanted quality. Today, clear in this house, elaborate that you are not able to provide the so-called quality, equitable, and fair service delivery, Mr. Speaker. Number two, how did the Jubilee therefore win the tender if they were not able to provide sufficient evidence of ability to provide the so-called quality service care to the employees of this county, Mr. Speaker? Number three, can Jubilee Health Insurance Limited Company explain to the House how Transnet, which to them, they felt that they are able to provide far much better quality services than them. The question is, can Jubilee Health Insurance Limited Company explain to the House how Transnet makes health care more affordable, more quality, and more equitable, opposed to the direct delivery from Jubilee Insurance? Maybe the next one is, what parameters were considered to inform the decision of capping and selection of health facilities in terms of who goes to which facility? How was that arrived at? Another one is, can Jubilee, on tender document and specification, Mr. Speaker, I'm looking at, can Jubilee Health Insurance Limited Company explain with legal backing, Mr. Speaker, legal backing, evidence the scope of medical cover and the benefits limits and entitlements, including entitlement per visit, that when one goes to LCRH, for example, to Maine, for example, or St. Luke, or Eldoret Hospital, or whichever facility, how much is this person entitled per visit, so that we know exactly why is the outcry of the public over the insurance. Because I have been working with the county government before I came to this house. Britam has been providing insurance to county government. Jubilee has been providing insurance to county government employees. There was no outcry. Why this time? There must be something wrong between the process of the insurance, the broker, and county government itself. So we must delineate and know exactly where the problem is, because we cannot be here representing the people of this county and leave the employees of this county to continue suffering and even losing life of the dear ones, Mr. Speaker. So, Mr. Speaker, we need to have a way forward today that will give us something that is memorable for the employees of this county. If the so-called insurance, we are having Jubilee insurance in this county assembly. It's providing us with quality service. We have not complained. Therefore, it means how they are providing the service in this county assembly is not the same way they are providing service to executive, Mr. Speaker, county government executive, Mr. Speaker. Therefore, there is something wrong. They should be clear to us. Where is the problem? If there is somewhere this money is supposed to be chopped so that you are not able to provide the quality service that you are providing to county assembly members, then we should be clear about it so that we are able to discuss something that we can help the public and can help the public for once and for all, Mr. Speaker. Thank you, Mr. Speaker.
Okay, because you are kind enough to extend the time, the Speaker will also be kind enough to extend the time from 2 minutes to 3 minutes. But be brief, straight to the point. Ngimusia.
Thank you, Mr. Speaker. I only have 3 questions, and this is a very important session, and it concerns the health of our staff. And during the suspension period, our people suffered a lot. And my question is to the ministry and CECs, what are the measures? What measures have you put in place so that this situation cannot repeat? The situation that caused the suspension, the situation that made people to suffer, people lost life. What are the measures that you have put in place so that this thing does not repeat? That's my first question. The second question is, I just want to go only to add also on the issue of the broker. You know, even the word broker tells you more about that. You know, because in the other aspect of life, when there is a broker between, you know, that thing does not, sometimes it becomes challenging. So I want just to ask the question is, what is the role in this agreement? What is the role of that broker? And what's the role of the Jubilee? And so on. So that's my second question. My third question is, during the suspension, our staff were not getting services. So the Jubilee had suspended providing services and everybody there. So do you deserve to be paid during that time? Are they deserve to be paid for the suspension? That period of suspension, there was no, like the agreement was not there working, and the people are not getting medicine and so on. Do you deserve to be paid? So which means they are not supposed to be paid by that. That's according to my observation, but I want to know that question. Thank you, Mr. Speaker. That's my
Thank you, Honorable Ngimsa. Now let's allow them to respond. We say this is first round. So we begin with public service. Those questions that were directed to you, kindly. After that, we will have the CC Finance and Jubilee and Kasnev.
Thank you, Mr. Speaker. Mr. Speaker, some of the questions that have been raised by the honorable members, some honorable members, Mr. Speaker. Though it is part of the questions that were directed, require enough time so that the executive can provide justification or sufficient information regarding to that. That is in regard to a number of questions raised by Honorable Abdi Fattah. The issue to do with the documents, specification, all that. It requires time so that we provide sufficient information regarding that. I would wish, through you, Honorable Speaker, at least if that opportunity can be given, we will provide the required information so far in regards to the discussion of today, because it is very important, Honorable Speaker. Honorable Speaker, again, we have been pumped with a lot of questions. And I will be sorry if some questions that were directed to me, if I will miss at least to respond to some. Honorable Speaker, the burning issues here are, I have one time been the majority leader in this county assembly before I joined the executive. And the burning issue by that time, when we were enjoying the medical services, we had an issue to do with the brokers. And I'm sure some honorable members here joined this county assembly and they realized that pertinent issue was there. I was happy enough to learn that recently changes came in and they are enjoying the services without the so-called broker in between. I will not be ashamed enough on behalf of the county government of Turkana, because life is very important. I will not be ashamed to say we require such a services the county assembly of Turkana are enjoying. And that is through Jubilee. Honorable Speaker, my job group is rated with a capping of 2,400 as a CEC. Honorable Speaker, I have worked with the humanitarian organization. And you could enjoy insurance services without realizing that there is capping somewhere. So that's why I tend to say the Jubilee of today is not the original Jubilee. If Transneb has been working there before, it is not the Transneb that was there before. So, if my job group as county executive can be rated to a capping of 2,400, what about somebody of job group F? So that is that. Mr. Speaker, I would want to start maybe responding from Honorable Ngimusa, that what measures? The measures that we have in place, and I intend personally on behalf of, as the head of the public service there, is that the Turkana people deserve to get quality services and affordable services. And therefore, it is clear that the county government of Turkana dealt priority with the Jubilee insurance. Where the broker comes in, I don't know. So if measures are to be put there, we would feel to work directly with the Jubilee. The same issue is also being discussed in our cabinet. So it won't be so bad even for you, the legislators, at least being the responsible representatives of the citizens of county executives as well as the entire county, at least to make sure that they are getting the right services required. During the period of suspension, do the insurance deserve to be paid? You will ask them. You will ask them. Honorable Speaker, the listing of the hospitals, some hospitals from the medical services. Honorable Speaker, you will ask the Jubilee. Just ask the Jubilee and the Transnep. Because for us, we feel at least to get good services. I am rated at least to take services in Lodwar Hills than Namo. You see? How come? So, just ask them. It's good at diarrhea. Mr. Speaker, the question raised by my classmate, Honorable Anakilet, not even my class, my desk mate, is that some questions raised by Honorable Nakilet will be answered by my able chief officer here. Then, on issue to do with the documents, we will provide, if that opportunity is given through the Honorable Speaker. Whose interest? Honorable Speaker, I am an employee of the county government. And therefore, the interest I play the interest of the county government and with its employees. I myself being an employee of the county government. About the insurance, whichever a broker or direct insurance, I am not there. I am there to protect the interest of the Turkana County government and its employees. What I do with the Jubilee is only the partnership in terms of businesses. We will provide the minutes of the meetings. And in this case, the letter will provide the meeting of the minutes. We will provide also our commitment engaging Jubilee or Transnep. And in most cases, our letters were directed to Jubilee, copied to Transnep. And in our commitment, the letter from the CEC Finance surpassed our letters as the public service. So it's because they know that they have to engage the person controlling the important office over. So, questions that was raised by Honorable Abdul Fattah, I have said it requires time. Issues to do with the tender, if it is open, advertisement, value of broker, what percentages, how the TCG engaged. So it requires time so that we provide or serve you with sufficient information, Honorable Speaker. So otherwise, that is what I can answer. Then anything left, you can allow me to bring in my chief officer.
On which question is left? Which question is left? You know, you should say this question, not open. When it's open, it will not be right. Which question in particular? Not sure. CC Finance.
Information, Honorable Speaker.
Honorable Abdul Fattah, we are on question time. They are answering.
Honorable Speaker, my questions are not answered, and I need to know the reasons why they have not been answered. Not all questions need time. I need the CEC to be specific. On which questions does he want to be deferred? Which ones is he ready to answer?
Abdul Fattah, you are speaking in this assembly and you are seated. You are sitting. Are you in Nabarasa?
Sorry, Honorable Speaker, I beg.
Okay, ask what you want to ask.
Honorable Speaker, my questions are not well answered. I needed the CEC to tell me these questions needed time. Questions on procurement needed time. Questions on contractual terms, this is what he can answer, this is what he cannot answer. Note that all questions have been closed and he needed time. When is he going to deliver the response? Thank you.
CC Finance, you got questions from Abdul Fattah, all of them?
Honorable Speaker, there was no question directed to me from Honorable Abdul Fattah.
No.
Thank you.
CC Finance, I'm asking CC Public Service, because that's where the contract is, the contract, the letter of agreement, the broker.
Thank you, Mr. Speaker. Mr. Speaker, you are there to protect all of us, both the honorable members and the executive. When I stand and say, as per the questions raised by any honorable member here, that it requires time so that I provide, I am confidently enough that the information I will give here will not satisfy the request of the honorable member. So if time will be given, then I will serve this honorable house with the required information sufficiently. So I request the honorable member at least to listen to me, and I serve him well. Thank you, Honorable Speaker.
Honorable Abdul Fattah, I am not giving you a chance to speak, but I want to draw your attention to what the CC has said. And I will make that judgment later on that question. Honorable Abdul Fattah, no, not this time. I say I will make that judgment because I have all the questions you asked. I have all of them. You can see me writing. So I will make that judgment later. CC Finance, you have no questions? There was no question directed.
Honorable Chair, there was one question from Honorable Francis. Honorable Chair, I know we're obligated to ensure that we have what it takes for us to provide the medical cover. We've raised this in this house that the budget that was there was not enough. We only had 265 million. Against what was needed was 400 and 25 million. And because of that, that is why we sought from the supplementary for us to be able to get the balance so that we can be able to pay the underwriter whatever they need for us to get the cover. And it is my wish and my plea to this House, because even as we are coming to the end of this contract, we actually still have challenges because of the staff that we have. We have additional staff. Whatever is in the budget is not enough. We'll still seek the House when it comes to budgeting for us to be able to have all that we need for us to be able to adequately provide for the medical insurance for the staff. As my counterpart has alluded, and he has informed this House, we are also trying to discuss the same issues at the cabinet level so that we are able to provide medical cover to all of us, because even us are affected. It is not only the other staff that are affected. Earlier on, the staff thought maybe the CECs, the chief officers, are being treated well than them. But collectively, all of us have issues with the medical cover, such that we will take it upon ourselves, even at the cabinet level, to discuss and see what alternatives do we have. We've already even engaged with the CEC for Health to look even to see whether even the comprehensive share can be used if it is better for us to be able to get services. But all this will be discussed, and we see how best we can be able to ensure that we get medical cover to all the staff. Thank you, Honorable Chair.
Jubilee.
Thank you, Mr. Speaker. Honorable members, allow me to respond to a few questions that were directed to me. I want to assure this House, Mr. Speaker, that Jubilee continues and has been able to provide insurance cover for the past 90 years. We were incorporated in 1937. We operate across 5 countries. We're the largest insurer in East and Central Africa. And we are part of the wider Aga Khan Development Network, which includes, amongst others, the Serena Group, the Aga Khan Hospitals, Nation Media Group, and Diamond Trust Bank, to mention just a few. So Jubilee is not in any way incapacitated in delivering its service. Allow me, Mr. Speaker and honorable members, to explain just a bit of insurance concepts. In insurance law, there are 2 types of relationships. There is a principal-agent relationship, and the law of agency is such that the client appoints a broker to mediate on their behalf. The principal, as an underwriter, as is in your cover, may appoint an agent to intermediate. So I would request that as the documents are tabled from the executive team, you review how the award was done, to whom it was given, and how the cover was placed on Jubilee. Because as far as we are concerned, the principal-agency relationship here, in this case, the principal is a client, the agent is a broker. In your cover, the principal is Jubilee Health Insurance, and we may choose to appoint an agent to represent us. Therefore, and I request for your protection, Mr. Speaker, to the brand, the strength, and the diligence of this responsible corporate citizen who's Jubilee Health Insurance, such that our core values would not be smeared with allegations of bribery. We are part of, as I mentioned, the Ghana Development Network, and integrity is key for us. So as to the role of the broker, the principal will explain better. And I hope you've gotten who the principal in that relationship is. Provider empanelment is a prerogative of the risk carrier. And I just want to respond to a few questions about why is it that the cover for the county assembly is much better than the cover for the executive. And this I will probably lobby on behalf of the executive on this matter. The average premium per member here is 46,000 shillings. You have about 1,300 lives that we cover for this scheme here, and your average premium per life here is about 46,000 shillings. It's about 20,000 for the county executive staff. It points to a budgetary deficit, and we can manage this in many ways to try and mitigate the loss, because ultimately I'm the one who carries the loss. And we have discussed previously, and we've disclosed our financial performance for this policy. For the last 3 years, it has not made a profit for Jubilee Insurance. And we are ready to provide those reports to this House. But ultimately, Jubilee, as the underwriter, because I remain with the short end of the stick when either premium is not sufficient, premium is not paid on time. As the underwriter, you have to mitigate your loss. One of the commonest sources of loss for us, and you've seen it even in the national SHA scheme, is fraud. We won't sugarcoat it. It is the truth. There's a lot of theft. There's a lot of phantom admissions. There are a lot of unnecessary repeat visits. And unfortunately, that soils the trust that exists between us and some providers. And I can assure you, they will not be on the panel. If I lose business because I have knocked out a fraudulent provider, then I will uphold my integrity. And we have had many providers, some of them even recommended by this House for your policy, who we have turned down because we have experience with them with fraud. And part of the reason why they would even have the audacity to cap the benefits of a CEC is because they don't know. And as I've said before, we have continually asked for this feedback so that we know who is sending my customers away, and we deal with them. And we have dealt with some of them before. We will not start today. We have done it. We'll continue doing it. It is not how we operate, because you have experienced our quality service. But if there are individuals who want to cut corners and make some money out of the medical cover for the county executive staff in terms of providing fraudulent services at provider level, as I mentioned earlier, our fiduciary responsibility to this country, because we are a corporate taxpayer and individual taxpayer, is to safeguard those resources. We will safeguard them. So provider empanelment remains our prerogative. We contract providers as and when necessary, depending on the requirements of the level of care required. And I want to issue a challenge that if there is any evidence that we have not provided sufficient coverage. You see, honorable members, Mr. Speaker, when someone is unwell, they need to get better. That is what they're looking for when they go to hospital. They're looking to get better. They're not looking to sit on a sofa. Why is it that in healthcare, usually on my normal days, I don't eat lunch at Hilton or expensive hotels because I'm paying out of pocket, isn't it? Why is it that in healthcare, because someone else is buying for you, you'll go to the most expensive place? I will show you statistics if you'd want to request for them, that a common cold in some of the facilities that people go to, homa, hii ya kawaida tunakunywa dawa, costs 9,000 shillings per visit. On whose account? And how long are we going to tolerate that? So we have to ask ourselves those hard questions so that we can start answering and making sure this scheme is sustainable. Otherwise, we can dance around it and we can say, Jubilee is not giving good service. And we'll move to another provider. These things will remain. Because that is the principle of risk and loss control in insurance. It will not change. Insurance merges three sciences: medical insurance. I'm a medical doctor and an insurer by training. The other science left there is actuarial science. All of the decisions we make, the tailoring of the panel, the access to the panel, the vigilance over the panel and service provision are based on sound scientific data. It is not about to change, and I can assure this House it will continue being there. I beg to submit that, Honorable Speaker. If there's any other question, I'll respond to it.
Okay. Dr. Musa, are you suggesting that the county government staff are too extravagant at some stage? I'm not saying you answer, but from your sentiment, I get that. Transnep?
Mr. Speaker, there's a question I've not responded to. With your permission,
Okay.
if I could respond to it. And just to answer your question, Mr. Speaker, yes, there are some that are quite extravagant on the cover. And we will deal with it. During the suspension, we continued to carry the risk. When I underwrote the policy in June last year, I paid stamp duty to the government and I paid tax for the full premium. And I continued as Jubilee to pay claims for the duration of time when I could have used that money, which I got from another policyholder, to invest and make some profit. But instead, we used that money to pay claims for a premium we had not received. I find it unfair to suggest that we are not entitled to full premium. I'll request your indulgence. But in any case, an insurance contract for medical cover, the policy is written for 1 year. And you remain fully covered for that 1 year. And that is why we said, if there's an individual who has incurred a claim during the period of suspension, by all means. And we were quite judicious. During the time of suspension, we maintained close contact with the county executive that any of our members who required advanced care, we provided it. And I dare say we can table those documents here, save for data protection. We can table the numbers, the member numbers of and the claims and the bills that we undertook during the period when ideally we should not have undertaken the bill. If we were to sit back and also nitpick every single line, then I should be suing for lost income for premium that I didn't receive in 6 months, isn't it? But that's not the spirit of partnership. That is not what we're trying to build here. What we're trying to build is a sustainable medical cover that answers quite specific questions. Is access guaranteed? And when access is guaranteed, do we get better? Do our customers get better? I submit, Mr. Speaker.
Trustnap.
Thank you, Mr. Speaker and the Honorable House. Transnep, I think, is the most mentioned in this House today. But I dare say we are a strong company. We've been there for 13 years. And currently we are serving over 22 counties. That is information you can get outside there. So we did not start with Turkana, and we are not a scam, we are not a scheme. We are actually serving people outside there and county assemblies. And so I also seek, Mr. Speaker, protection against our brand. Because what Dr. Musa has said, when you get the documents from the executive, see how the tender was done. We participate. We have 2 licenses. One from IRA as a broker, who people assume a broker is like the broker of the land and other things, but medical insurance brokerage is a bit quite diverse. And that is why even when the suspension was happening, a lot of this ex gratia, we were the ones called. When people are stranded in hospital, most of the time we are the ones who pick. We have a 24-hour call center. Not that Jubilee is not adequate. It's because Jubilee is one of the biggest insurance, and that's why we chose them. 24 hours, they are serving the biggest portfolio in this country and East Africa. So we have given value to our clients by establishing a running call center, something running parallel so that there is ease of communication. So I needed to state that we are a very strong company, 13 years old, serving other county governments. And what have been spoken here about the issues of service being associated with Transnep might not be the case, but I will leave the House to judge upon submission of the documents, because the risk carrier, like Jubilee, what Dr. Musa has explained, the rules or who is to see the client, who is not to see the contractor with the hospitals, doesn't sit with Transnep. Our work is advisory, our work is to ensure services are delivered. And in between, when services are closed, we are the same people who are trying to mediate up until where we cannot, because you can only also do too much because of the responsibility of premiums. If the premiums are paid also, we can only do too much. So it is important to mention, because I was answering to the question, what is the role of the broker? Once you get to know how, we actually participate actively in tenders, actively, and we are awarded, and we serve our clients. The other question that was directed was, I think, to an honorable member who've left. That's information. They've asked about our CR12. They've asked about who we are. And that is information, because when you're doing the tender, there's a part for mandatory requirements, and we actually submit who we are, our licenses, our valid license. So when we work backwards and the documents are submitted, I believe Honorable Abdi Fattah will be able to get those documents, because they were submitted during the tender process. That will be my submission for now. Thank you.
As you stand, before I go for another round, between you and Jubilee, who is conversant with LCT to tell us? Because up to now, I still don't know who is LCT.
Mr. Speaker, I'll respond to that. Jubilee Health Insurance is an insurer. We are not a technology company. But over time, technology companies have been licensed to provide identification services for medical insurance, particularly biometric identification, claims transmission, and ability for us to have a real-time view of utilization of the cover. So LCT, you're using, I think, SLED for the county assembly or SMART, whichever platform it is. LCT is a technology platform that we use for biometric identification, verification, benefit management, and provider management. They're not an administrator, they're not a risk carrier. Jubilee is a risk carrier, we are the underwriter, and we have used available technology platforms for this.
So LCT is a technology that is used for accessing those services.
Yes, Mr. Speaker.
Yes, so it's not a person. It is a technology like Safaricom, like Airtel, like any other. So that is when you give your number, honorable members, when you go to a facility, you are asked where County Assembly of Turkana. Then they tell you when they press, that is what gives you the feedback of whether you are entitled or not. That is the one that can give you the balance even of what you, whether outpatient or inpatient. Is that the case?
Yes, that's
so,
the case, Mr.
So it's not a person.
SLADE and SMART are the same. They are the same. It is, you're looking at cost effectiveness when you're making a decision on who to use. And in this case, honestly, the budget is a bit constrained. So, yeah.
Okay, thank you. Now we go for round 2. We begin with, and kindly ask the specific question to a specific partner, so that when they wake up to answer, or when we are asking, they can be able to take those questions. Honorable Moro.
Thank you so much, Honorable Speaker, sir. Honorable Speaker, sir, first and foremost, allow me to thank Honorable Mike, the MCA for Lapur, for bringing this question in good time. Honorable Speaker, sir, it's in record that the public service workforce for the county government of Turkana has been raising complaints in as far as issues to do with medical cover are concerned. Mr. Speaker, the contract law is very clear and it stipulates on the principles of offer, acceptance, consideration, and it also speaks about the breach and remedies. Mr. Speaker, you've heard the Jubilee Insurance saying that they did not receive payment in the right time, and the County Executive Committee member for Finance has clearly given the response to this Honorable House that on July of 9th, 2025, the county government of Turkana paid Jubilee Insurance 265 million. And on March 2nd, Mr. Speaker, 2026, the county government of Turkana paid Jubilee Insurance 144 million. And there is a balance of 16 million that is supposed to be paid by the county government of Turkana. Mr. Speaker, my question is on the value for money. And that one specifically will not be to Jubilee. That one will be specifically to the county government of Turkana. Have the staffs of this county received the value for money that the county government has paid the Jubilee Insurance together with the broker? If the answer is yes, the CC should tell us. Mr. Speaker, value for money hasn't been realized. You remember last time, the nurses and even the clinical officers were demonstrating in this county. And one among the issues that the nurses and the clinical officers were demonstrating for is the issue of the medical cover, Mr. Speaker. And number two, it was the issue of SHA payment, Mr. Speaker. Mr. Speaker, the county government of Turkana is supposed to remit SHA statutorily on 9th on the next month, Mr. Speaker. Mr. Speaker, I know there are challenges with the control of budget releasing funds in time. And to date, even county government employees will go to any facility accessing SHA services and they may not get, and the reason is late payment by SHA, Mr. Speaker. Is the county government of Turkana paying for penalties on behalf of their staff for paying monies lately? Mr. Speaker, that is a question that I want to inquire with the CC for Finance. Mr. Speaker, the insurance law in this republic clearly outlines the duty of utmost good faith, or what we call the oberi mai fidei. Mr. Speaker, I am a student who did CPA up to the last part, CPA Part 3, Section 6, and I remember insurance was one of the laws which I did in Section 4, Part 2 of CPA, Honorable Speaker. Honorable Speaker, in that principle of utmost good faith, or the so-called oberi mai fidei, Mr. Speaker, it will be unfair for the service provider to terminate or to stop the service. Yet they understand that the client who has given them the opportunity is having a budget line that they are supposed to pay for. So, Mr. Speaker, I want to get from Jubilee Insurance, are you still upholding that principle of utmost good faith with the county government of Turkana? Mr. Speaker, there are remedies that are available, especially to the insurer and to the broker, especially when there is non-compliance with the insurance regulatory rules, and it normally amounts to sanctions up to including to fines and license implications, Honorable Speaker. Honorable Speaker, most of the staff of this county, up to including a nurse, who died. Mr. Speaker, we know the underlying condition that the nurse had, but that nurse died as a result of lacking the medical cover, Mr. Speaker. Mr. Speaker, that nurse is, I don't know whether it's been buried. He was supposed to be buried in Kerio. We are discussing about the painful state of how the very, very many staffs in this county are complaining. Mr. Speaker, I have another case. I have the son to a village administrator in Lokichar, a village administrator from a village unit called Kasroi. Mr. Speaker, I happened to attend the fundraiser to raise funds so that tumor could be treated to that son, Mr. Speaker. Mr. Speaker, that was a time when this cover was not working. But through the intervention by the chief officer, I must thank her, she's here. I had discussed with her on how they can use the ex gratia amount to try and handle the issue of that patient, Mr. Speaker. I don't know how far, because I represent the people of Lokichar in this assembly, Mr. Speaker, I don't know how far the issue of that child has been handled, Mr. Speaker. Remember, this is a child to the village administrator who is supposed to undergo tumor. And I remember even the members of this county assembly, there is a time I posted that we want to seek support for that child in this county assembly, Mr. Speaker. Mr. Speaker, my point is, finally, on the issue of LCT. Now that the County Executive Committee member for Finance and Public Service have highlighted to this Honorable House the benefit structure by the job group. Job group RT up to job group AF. There are inpatient services, there are outpatient services, there are maternity services, dental services, and optical services, Honorable Speaker. Honorable Speaker, we've been told by the Jubilee that LCT is a technology I want to be very, very clear on their response. Honorable Speaker, they are saying that LCT is a technology that Jubilee are using to support real-time eligibility verification, authorization of service, reporting, and fraud management. And they've also said that these integrated systems helps to ensure that services are provided within the approved scope of cover. Mr. Speaker, very simple question. Why is it that we have the amount that has been prescribed by SRC, that this is the amount that this patient is supposed to use? Why do you again put that capping? Yet already the benefit structure has been given by job group. We want to understand that aspect. I know you are discussing about the risk. You are discussing about probably a client getting to the facility and he uses more amount. But if you have given a service that the county government of Turkana has to pay premiums to amounts probably for job group A to F, for inpatient services you've said that 750,000 is supposed to be used. That is the maximum amount. Probably 100,000 for outpatient. Why do you again have to cap, Mr. Speaker? We need to understand that one very, very clearly. Other than the aspect of risk, why do you have to cap? And the SRC has already stipulated on the amount of money that a staff or a client has to use. Mr. Speaker, the final thing is on whether it is mandatory for a county government to use a broker. Mr. Speaker, the answer is it is not mandatory. It is not mandatory. And Honorable Speaker, the Kenyan law allows two models. It allows the county insurer, the county and the insurer, that is direct contract. And number two, it allows the insurance broker and the insurer. That is the intermediated contract. Mr. Speaker, you've heard very clearly from Jubilee Insurance that normally when they get the contract, it is them who should identify the broker. And Mr. Speaker, this time round, it was the county government of Turkana identifying. Is it the county? It is Jubilee again. Okay. It is Jubilee Insurance that is supposed to. It is Transnet.
Just proceed. Proceed.
You'll get.
They will respond.
You'll give the clarification. I think I heard him saying that that the county government of Turkana floats the contract. When they float the contract, they bid for it. When they bid for it, then the county government of Turkana will award the contract to a successful bidder. Then it will be upon the successful bidder to get the broker, Honorable Speaker. So, Honorable Speaker, I want to understand who identified the broker in this case. Is it the county government of Turkana? Is it the Jubilee Insurance? Mr. Speaker, that is the question that I want to understand. Then, Mr. Speaker, finally, I have said that it's not mandatory. We've heard that the issue that you're discussing about today is specifically touching on the cry that the members of the public have raised. I have posed my question on the CC finance for the value of money. The county government of Turkana to date has paid 409 million shillings to the contractor who was given the opportunity to provide medical service, Mr. Speaker. Mr. Speaker, and they are still saying that in the supplementary budget, they are supposed to get additional 16 million, Mr. Speaker. Mr. Speaker, my final question will go to the county government of Turkana, which we have now that is the CC for public service and the CC for finance. At the moment, we are being told that the number of staff who are in the county government of Turkana are 6,003. I don't know whether that is the right number. 6,003. That is the number that I heard from the county executive committee member for public service. And if I did not got it right, I will sought for clarification when he gives this response, Mr. Speaker. Mr. Speaker, we need to be honest. We need to be honest in this discussion. There are staffs in this county government, Mr. Speaker, who haven't even benefited, who haven't even gotten the opportunity to be registered on this medical cover. And the issue is the premiums are very low. The amounts of money that are budgeted for is very low, Mr. Speaker. Mr. Speaker, how many more other people should be recruited in this county for us to put those others who have been in service into this mess, Mr. Speaker? We are reliably informed that there are more people who are supposed to be recruited, Mr. Speaker, and we are past the wage bill, Honorable Speaker. Honorable Speaker, why should the county government continue recruiting more workforce at the expense of making those who have been in the system suffer, Honorable Speaker? Honorable Speaker, this is not a light matter. We can count the number of persons who have lost life. We have a demoralized public service in this county, Honorable Speaker. When the CC tells us that they are in discussions with the CC for Health to see whether they can get into a comprehensive share, Mr. Speaker, share is mandatory because it's being deducted from each and every employee, Mr. Speaker, payslip. That amount is deducted directly from the payslip using the law that was approved nationally, Mr. Speaker. Mr. Speaker, the share that the CC is alluding for is already having challenges, Mr. Speaker, up to including late payments. Monies are being paid late, and when the staff gets to get this service, he's being denied the service and is being told money has not been remitted, Mr. Speaker. And I may not blame the CC. The issue is exchequer releases that are normally given by the control of budget. So I want to inquire with the CC for public service. How many more other employees do you want to employ in this county for you to put others at the expense of suffering? Thank you, Honorable Speaker.
Thank you. Honorable members, I want to believe Honorable Samuel Lomodo was the last to give his comments and remarks. Thank you. For the interest of time, let me allow the CC for Public Service to respond to the issues. Then thereafter, the CC for Finance and the Jubilee representative, and finally, Transnet representative. The CC for Public Service, you may proceed.
Thank you, Mr. Speaker. Mr. Speaker, our county staffs, those that are active on payroll are 5,353. Those not on payroll is 956, totaling to 6,309. And questions raised by Honorable Lomodo that how many staffs do you still want to employ? Yeah, that depends as per the staff's establishment that was launched on 5th of August, 2024. So that is it. Honorable Speaker.
Thank you. CC for Finance, proceed.
Honorable Chair, the question has been asked on value for money and whether whatever we've already paid has served as well as a county government. And also issues around SHA. I'm happy that the honorable member had already exonerated us from the blame on the SHA, because most of the time SHA is associated with payment of salaries, and anytime it delays, then it becomes an issue for us. So in terms of SHA, at least for now, we can happily report that it is working. Even me, I used it the other day, so I'm happy for that. And in terms of the penalties that they normally put every time we are late, we've actually written to them to seek for a waiver, because the delay is not occasioned from ourselves. It is actually because our COB, which is also part of the government, delays. So in the spirit of intergovernmental working, we've actually requested for that waiver from the SHA. In terms of issues around value for money, I think maybe the insurance, the Jubilee insurance can tell us if they feel that whatever we've paid, and with the fact that for some months we've not been having services, if they feel that they have served us well. We know we had an obligation as a county government to pay the full amount. We also know as a county government that we had that obligation, but because of budgeting issues and the timelines, we were not able to undertake that particular obligation. But even notwithstanding that, we actually kept communicating to them that this is the position we are at as a county government. So from ourselves, we were able to communicate. That shows goodwill on our part as well, as the people who are using the cover. So in terms of value for money, I'll throw that ball to Dr. to tell us. Other than that, I will continue saying that we have the interest of the staff at heart, and we'll continue to ensure that we do everything possible from our part to ensure that we get well served, we get good services, and to ensure that everyone is served. And I submit. Thank you.
Jubilee.
Mr. Speaker, honorable members, allow me to respond to the question raised by the honorable member on whether Jubilee is applying the principle of utmost good faith. Insurance, and the government of Kenya has been very keen on regulating the insurance industry, for the reason that trust in the insurance industry has been quite low for a long time. And the guardrails the regulator has put in place are meant to protect policyholders and protect confidence in using insurance as a tool for financial protection. Utmost good faith would mean that you would go and undertake a risk without premium, and do that for the first month to the 7th month. That is good. Utmost good faith would also mean that you realize, I took the Hippocratic oath. I'm extremely saddened to hear of loss of life, but I'm also reliably informed the loss of life happened in hospital. Utmost good faith also means that you realize that there could be emergencies and contingencies that are beyond the need for premium and that you would undertake them. And we have those cases. Not one, not two, we have several cases. So does Jubilee practice utmost good faith? Absolutely. But we have to operate within the confines of regulation. Because at the end of the day, my regulator looks at my capital and my solvency and my ability to be able to incur liabilities for the periods under coverage. And if I do not have enough capital to sustain that coverage, it becomes a difficult position. You have seen 3, 4 insurers placed under statutory management. I want to assure this House Jubilee is very far from there. And probably it's because we try and collect premium as much as possible. The second question, and I want to clarify, is on the role of the broker and whether Jubilee appointed the broker. This tender was floated to medical insurance providers. Medical insurance providers are not insurance companies. They are a particular class of companies regulated by the Insurance Regulatory Authority who are issued with a medical insurance provider license. Transnep is one of them. Prior to Transnep, there was Minet. And those documents are available for this House to review. They bid, and one of the roles that the county executive has responded to, as on the role of the broker, was placement of the policy. And so Transnep chose to place the policy with Jubilee. The relationship I was explaining earlier of who the principal is in an insurance relationship, who is the controlling entity in an insurance relationship, where you will see an insurance agent, they are working on behalf of the underwriter, the insurance company, who is the principal. When there is an insurance broker, or a financial broker for that matter, a broker legally is mandated to work for the client and hence are appointed by the client. And hence, it would be good for the House to review the documentations provided. That relationship will be quite clear. It will also be clear why the county government, through Transnep, opted to place their risk with Jubilee Health Insurance. Thank you, Mr. Speaker. That's my submission.
Transnep.
Honorable Speaker.
Honorable Moro.
I've had the response by...
Take your seat.
Honorable Speaker, I've had the clear response by the representative of Jubilee Insurance, but I have not heard him responding on the issue of themselves when they were signing the contract. They were giving the benefit structure as per SRC. SRC is giving a benefit structure on what the employee is supposed to get. And when they signed that contract, they followed that probably an employee on job group R to T for inpatient services is supposed to get 2 million, outpatient services 250, and probably for employee job group A to F, as per SRC, that employee is supposed to get a service up to a tune of 750,000 for inpatient, and for outpatient probably 100,000. So I asked them, why now bring the issue of LCT, yet the premiums are clear as per the SRC. Thank you.
Mr. Speaker, on the issue of benefits, benefits cannot be altered. Benefits cannot be altered. If you went to hospital, and I'll give an example. I think the patient we dealt with during the period of suspension who went to ICU was in job group K, if I remember correctly, entitled to about 750, and we paid the entire 750,000. Your benefits are not altered whatsoever. The issue of providers sending away our customers In this case, the members of the county executive employees are our customers. The issue of providers sending away customers because they have reached 2,000, it's a fraudulent, manipulative scheme for them to extract as much payments from the underwriter as possible. And I mentioned it earlier. It is something we continue to fight. Hopefully we can get support for the House to fight it. And the use of technology is meant for us to monitor a few utilization behaviors. And just give you a bit of an example. Between September and December, there is a staff member, an employee of the county executive, who went to hospital 75 times. I did some reading. I don't think there's a condition you can go to hospital for 75 times in 2 months. So there is abuse, there is waste. And why it is very painful is because it's not a victimless crime. When you take that money, we later realized, another example in a different county, someone went to hospital 90-something times in 2 months, only for us to realize he had a pharmacy. So he used to go to hospital, take drugs, and stock his pharmacy. These things happen. Help us resolve them. Because unless we resolve these things and fundamentally address this thing, then the bigger majority who don't engage in fraud continue to suffer the limitation and the scrutiny of how many visits have you had. The genuine members suffer because of a few. So it's my prayer for your indulgence, Mr. Speaker, and this Honorable House, to support the county executive and ourselves, where there will be sometimes outcry when we've tightened the belt a bit to control some of that waste and abuse. Just for your indulgence, to understand that we are trying as much as possible to ensure we are utilizing these benefits as best as we can. But we do not alter SRC benefits.
What about the status of the tumor child?
On Lomodo, is it one-on-one now?
No. Thank you, Honorable Speaker.
Yes, ask what you wanted to ask.
Honorable Speaker, thank you so much. Through you, I had wanted to get probably feedback on that tumor child who was supposed to be operated in Lokichar. Is from Lokichar, is a child to a village administrator. Probably I want to get how far they've gone with treatment of that child.
Honorable Omero, you are out of order. Not here. It can't be discussed. That cannot be discussed in the assembly. You will see them after this. Go ahead.
Thank you, Honorable Speaker and the House. I would just attempt to answer, not in details, but that is our role as a broker. And we got that case through the executive. We got a request for ex gratia, and we've been having a conversation with Jubilee. Again, slightly affected by the delay in payment, because you cannot ask for an ex gratia to be helped when the payments had not come through. But after that, we have affirmation that Jubilee will support, and this is going over and beyond the contractual agreement. So as I finalize, and what Daktari has clarified is we bidded for the business, we got the business, and we usually give our business not only to Jubilee, we give to Britam, we give to AAR, we give to many other underwriters. But Jubilee, if you do your studies, are preferred because of their ability in very many parameters, because of their strong capabilities, both in Kenya and East Africa. And also just to clarify, Mr. Speaker, because it was raised in this House, that our presence does not influence your premium at all. So when we bid and Jubilee quoted and they gave us X amount, for purposes of discussion, the 400 million, it doesn't mean the broker will come and add a cost to it. When we place the business with the underwriter of choice, that is a person we have an agreement with, and that is the person who will see it through that us giving them the business is compensated in our own engagement, and this is not the only business. So I needed to clarify that having a broker does not add any, it's what was quoted, what was evaluated during the tender is the same thing you get. And you've heard from Daktari, there has been Binet, there has been other people before us. Only that we are now in this stage at this time. Thank you so much to the Honorable House.
Thank you, honorable members. We have business to 2:30, and we also, before that, we also another business of house business to allocate time to this house. And I believe we have asked enough for clarity. And this time I will give Honorable Mike a chance to say one or two as we conclude. Honorable Mike.
Thank you, Mr. Speaker. Mr. Speaker, once again, I want to thank the two county executive committee members and representative of Jubilee Insurance and Transnet for their responses and clarifications to the additional questions from raised by the honorable members. Mr. Speaker, I know you will guide later, but there are a number of issues that would require more clarity if time will be there, or if we will have some other engagement. One is in regard to the issue of Transnet. I know it's not yet clear. There are a number of issues that are not clear, and they will require to be further clarified. One, the issue of the medical cover having been suspended sometimes back on December 12th, 2025. Mr. Speaker, I know you will remember this matter was brought to this House sometimes back on November. So we will still require evidence from either the two CCs or the representatives of the Jubilee and Transnet, a communication, if there was any, that was made on the intention to suspend the medical cover on 12th of December 2025. We seem to be having conflicting information, because from where we sit, this matter began sometimes back on either September or October. Then number two, on the issue of the payment of the full premium. And yet, there was a time when the cover was temporarily suspended. Mr. Speaker, I thought this would have formed part of the negotiations between the county government and the Jubilee Insurance and Transnet, because now that the cover was temporarily suspended for the 3 months or so, because they are claiming 3 months or 4. So I thought that would have formed the basis for the negotiations for the Turkana County government not to pay full premium. Because, Mr. Speaker, the temporary suspension of the medical cover in itself was a breach of contract. And, Mr. Speaker, meaning the terms and conditions of the contract were not adhered to. So and, there were a lot of damages which were caused. And the damages in this case is the people or the members of staff from the county executive that we lost, and those who also paid their medical bills out of pocket, Mr. Speaker. Mr. Speaker, the reimbursements or the reimbursements that are referred here by both Transnep and Refugee and Jubilee, not all of these staff will submit their reimbursements. I know a number of them, they must have paid their medical bills out of pocket, and they have not submitted these reimbursements. Mr. Speaker, still the owner of Transnep is not known. So, and Mr. Speaker, the introduction of Transnep is of no benefit to the executive medical cover, and instead it has brought a lot of suffering to the county workforce. Mr. Speaker, going forward, as part of the key recommendations and the way forward, there is need to consider the termination of contracts with Jubilee and Transnet because they did not honor the current contract. So, and in fact, if need be, they will be forced to pay full damages, the damages that they have caused to our members of the executive. Mr. Speaker, there is also need to immediately terminate the contract with the broker so that the county government will engage directly with the underwriter, like what we are doing as a county assembly. We need to engage directly with the Jubilee for the county workforce to get their rightful benefits when it comes to the medical scheme, Mr. Speaker. Mr. Speaker, I want also to make this proposal that we need to engage the Office of the Auditor General to carry out 2 audits. One is the forensic audit that has to be carried because I have realized public resources have been lost because there are cases of transparency and accountability in the management of public resources. Mr. Speaker, the forensic audit has to investigate fraud or financial misappropriation for the legal evidence, Mr. Speaker. Mr. Speaker, the other type of audit that is supposed to be carried is the performance audit. Mr. Speaker, we need to carry out performance audit to ascertain whether the efficiency and effectiveness in the management of resources, to access the efficiency and effectiveness and equity in the utilization of public resources. Mr. Speaker, I beg also your chair to consider referring this matter to EACC for further investigation so that if there are officers, so that officers will be held accountable for the actions that led to suspension and interruptions of the medical care to the county, of the county staff. Mr. Speaker, these are serious issues that your chair has to make some consideration. And finally, issues of irregular recruitment of staff that has really compromised the provision of medical cover to the county workforce. So, and Mr. Speaker, that is the reason as to why in every supplementary budget, we have to increase the medical insurance allocation. So we need also to have a very strong recommendation in regard to the stoppage of the irregular recruitment that is done by the county executive. Mr. Speaker, these are some of the recommendations that I've put forward for your consideration, so that our members of staff would get access to medical services. Otherwise, as it is, our executive staff, they are struggling and they are suffering just because of the issues that I've pointed out. So, and this House has to stand tall so that some recommendations have to be put forward for the executive to implement for us to save the image of this county. Thank you, Mr. Speaker.
Thank you, Honorable Mike. Thank you, CECs and other county staff. Thank you, partner Jubilee and partner CASNEP. It is important that we have gone through this. We have asked questions that we have been able to ask. And Jubilee, you are our partner, and we wouldn't want to go into issues that will portray you as an organization as somebody who is unable to perform. However, things happen. And now going forward, I have the following guidance to make. One, this matter is referred to the Committee of Disaster Administration, call it what? Public Service Administration and Disaster Management. That is the committee where the insurance sits, because it is in the Ministry of Public Service. And what will be done, because I have seen even from those parties and us, that there's some information that is still lacking. And now to allow that information to be generated, then we need to have this matter referred to the committee. And this committee will do, one, will review the tripartite agreement. Look at the tripartite agreement. What is in the tripartite agreement? Who are these in the tripartite agreement? Then two, find out the source of capping, what reason is for this capping, and who is doing the capping. Because here this capping has just flied. If the SRC has said, this is my entitlement as a Speaker of this Assembly, outpatient, inpatient, and the rest, then where are these cappings? If SRC releases the money, the county government releases the money, then who is doing this other capping? Then the other thing for Jubilee, get us the names of approved facilities in this county, in other counties, and the nation, because sickness does not designate where to attack. So if that happens, which facilities are here? Which are those that you are referring to as fraudulent, that they go for 95 times in 2 months? I know there are hospitals in this, there are health facilities in this county where even us as the county assembly members do not go. One of them is NAMO. unless they have been listed this time. But you go to Nova, you get that access. Another one we have not, unless they have been listed, is Aviabora. Why that is so? It is the Jubilee that knows. I am talking for the County Assembly, not for the executive. Then there are letters that we had asked to be submitted, because we want to know, we want to get the authenticity of those letters if they were written. The CEC Public Service has also said they have letters they wrote. The CEC for Finance and Planning. Then the letter also from Jubilee, which now instructed the public service that service will be suspended. I know as Assembly there was also a letter that was written to me. I got, and it's normally through email. And you know, something funny is that we sent our contract to Jubilee to review and see if it is in tandem with what we want to do or not. Before returning it to us so that we use it for sending to the COB for payment, they wrote to us and they say, we are suspending the service. So I had to call the managing director one-on-one, that what is happening, because you have our contract, you are impending the process, and now you are telling us you will suspend the service. But I think that was done. We have no issues with our facility. We get into that. So those letters have to be sent. Then to Jubilee, we need a list of staff who have claimed for their reimbursement, list and the monies, so that we know these are the people who used their money during this time, and now it is time for them to get what they used, because that money was paid. Then that committee should also look at the staggered or the phased payments, where the Jubilee and the county government agreed that because we cannot pay 440 or 50 or 500 at once, we agree that we phase them, or we stagger. We pay them in phases. That this phase, we will pay this, another phase, we will pay. Let's also get that. And you see, from this, you will also be giving us the recommendation on what is in this. And I gather that committee will do that work and report to this House in 2 weeks' time. So by 7th of April, we would want to get that report submitted. It is so directed. Honorable members, now the Sergeant at Arms, you can now lead the parties out of the chamber. Next order.
Order number 9, motion and bills. Order number 10, adjournment.
Honorable members, I wish to meet with the House Business Committee immediately after this, so that we transact another business. Honorable members, there being no any other agenda to transact, the House stands adjourned until Wednesday, 25th March 2026 at 2 p.m. I thank you, honorable members.